Okay, we're going to call the meeting to order, and I believe we have a quorum for our fabulous staffers and Michelle. So welcome, everyone. Are we going to do the
Yeah, Carol's
going to do the
logistics. Yeah.
logistics, and then we'll come back and do introductions and approve our minutes and all of that.
Take it away, Carol.
Good morning. Going to spotlight myself. I'm going to spotlight our ASL interpreter. All right. Good morning. Good morning. My name is Carol DeAndres, and I'm the Stakeholder and Public Engagement Manager on the Master Plan for Aging team here at the California Department of Aging. Happy to be here with you today at the California Health and Human Service Agency's Alzheimer's disease and related disorders advisory committee. Today is the first day of February 2024, and this is the committee's first meeting for 2024. So I'm going to say Happy New Year to you all. I'm going to go over a few logistics as everyone is logging on and settling in. So let's move to the next slide, please. Welcome to this hybrid meeting. If you're appearing electronically, you're appearing by Zoom, you could join via this link. It's also on the Cal HHS website. Join by phone, here is the information. We have live captioning, American Sign Language. I want to thank our ASL interpreters. They're always so easy to work with, a great gift to us. Meeting slides and transcripts and recording can be found after this meeting on the Cal HHS Alzheimer's disease and related disorders webpage. Next slide. So I want to go over a few virtual meeting operations. The chat function is enabled for the committee members, California Department of Aging staff, and other state staff and invited guests to share meeting content, resources, and information with public people in the public via our Zoom chat function. The public is able to view the content shared in the chat during the meeting. We invite the public to provide comments. Please hold your comments until the designated public comment period. And additional public comments and questions can be posted in the Zoom question and answer feature, or always sent via email to engage, ENGAGE at aging.ca.gov. Next slide. Time is reserved on the meeting agenda for public comment. In-person comments in the room, raise your hand and let Michelle know that you have want to make a public comment, and Michelle will call on you. We will do the public in-person comments first. And those of us on the Zoom webinar function can provide verbal comments via the raised hand function in your Zoom toolbar. Or if you're appearing on the phone, you can press *9 on your dial pad, and we will unmute your line. And of course, as I said, written comments can always be provided to our email box, engage@aging.ca.gov. Do want to note that public commenters will have 2 minutes so that we can hear from everyone. Next slide. So now I'm going to turn the meeting over to our committee chair, Catherine Blakemore, and let me spotlight the room so we can hear from Catherine. So good morning, Catherine.
Good morning. Thanks for all the helpful information. We always appreciate you doing that for us. So just a couple of things, or one at least. I just want to let you know that Dr. Wynn Canio has been appointed as our vice chair, and we're very excited about that. She brings a breadth of experience to this committee. She's been a longtime participant, also a member of the Master Plan for Aging and lots of other things. So just welcome and thank you for taking on that responsibility. She replaces Derek Lamb, who had to leave our committee because he now works for the US Department of Health and Human Services. And that is, from their perspective, viewed as a conflict to be participating as a member of this committee. So many of us have wished him well in his new job. He'll be terrific and bring the breadth of his knowledge to that position as well. And as we did in the past, when we'll be chairing a portion of the meeting later on this day, because I think it's nice to have different voices in all aspects of doing this work. Because we're hybrid, and I know it's very hard to see who is in this room, and we actually can't see who's participating remotely. So I'm going to ask that people in the room go around and introduce themselves. Before we do that, I want to let you know that we have a new member for our committee present in the room, and we're very excited about that. Her name is Myra Garcia, and she is joining us as one of our committee members and consumer representatives. So we're just thrilled that she is here to be part of the committee. And I had a chance to speak with her this morning. She's from Southern California and has a long history of being involved in Alzheimer's related work. So we're very excited to have her, and she might say a bit more when we go around the room. But if people can just identify themselves and say what position they're filling or where they're from, I think that'll just be helpful. So Wynn, why don't you lead us off?
Hey, actually, I'm sorry. Rosie, can you advance to the slide that has the committee members list, please?
Great, thank you.
One more. Here we are. And so we can just take it in order here.
So Wynn,
Okay, great. Hi, I'm Wynn Canio. I'm a geriatrician and a psychiatrist in the North Bay. I'm a mental health representative in this committee. And as Catherine said, I am happy and honored to serve as the new vice chair for this committee.
Myra, should
Hello.
you introduce yourself?
Of course, thank you. I'm Myra Solano Garcia. I live in Upland, California, and this is my first time here with this extraordinary group of people. I am living with the disease and am very, very happy to be a part of this. Thank you.
Thank you.
I am Myra's sister Gia and her travel companion for this.
I'm Jason Gabhart, Director of Government Affairs for the Alzheimer's Association.
Thank you, and thanks for coming. I appreciate you.
Hi, Monica Miller, and I'm the contract lobbyist for Alzheimer's Los Angeles here in Sacramento.
Oh, terrific. That's great.
Hi, I'm Barbara McClendon. I'm the Public Policy Director with Alzheimer's Los Angeles, and I am the service provider representative.
Terrific.
Oh, my name is Sydney Skellinger, and I am the Senior Emergency Services Coordinator for the Department of Aging.
Terrific, thank you. We look forward to your presentation in a bit. And I think you all know Michelle, but I'm going to let her say good morning too.
Good morning, Michelle Johnston, Program Director for Dementia Initiatives with the California Department of Aging.
So let's just briefly go to those that are on the phone. I don't actually know, or on Zoom. I don't know who they are. So
Would you want to just go, actually,
because not everybody's here. that listens.
Rosie, could you go back a slide, please?
I think it will be. Is
There we go, and-
Dolores with us?
Yes,
Let's just go
Dolores.
through that. Yep.
Yeah, hi everyone. I'm Dolores Gallagher Thompson, and I'm a research professor and a psychologist at Stanford University. And I'm have spent a lot of time on caregiver research and clinical practice, and I'm the social research representative.
Terrific, thank you.
Glad you're here. Not here yet.
I'm sorry, Bill Mobley, Dr. Mobley.
Dr. Mobley is here.
Okay, Dr. Mobley.
Yeah, good morning, everybody. Bill Mobley from UC San Diego, a neurologist and neuroscientist, and especially interested, really pleased to be on this committee, think it's doing a great job, and very eager to see us attend to the issues of those with intellectual disabilities who have dementia.
Thank you. And
Sally is here.
okay, I was just going through the
Okay.
list here, is that okay?
Yeah.
So, Dr. Farias, are you here?
Yes, I'm here. Good morning. I'm Sarah Farias, and I directed the state-funded Alzheimer's Disease Center at UC Davis in Sacramento, and I represent the CADCs on this committee.
Terrific, thank you, welcome. Todd, are you here? I saw your name earlier.
Yes, good morning, everybody. Todd Shutter. I'm the Chief Operating Officer for Active Care Living. We're a service provider representative on the committee. We're from Southern California. Our specialty is purpose-built memory care communities, and we're also vendorized with the regional centers in San Diego and Orange County and have begun providing residential care for those with dementia and intellectual disabilities in our communities.
Terrific. Thank you. Welcome. And I think Ken, one of our new members, has joined us. Ken, do you want to introduce yourself and say?
Sure, yes, I'm Ken Graffio. I live here in California. I was diagnosed with Alzheimer's a little bit over 2 years ago, and this is my first time participating with the group, and I really look forward to it.
We are really happy to have you. So thanks, and I'm glad that you could join us. And Sally.
Yes, good morning. I'm Sally Berkman. I am an elder law and estate planning attorney. I practice in San Mateo.
Welcome. Thank you for joining.
Thank you.
I think we've covered all the committee members that I know that are here, correct?
Yes.
Want to introduce the staff, or should we wait till?
Yes, we can. I'm just looking, and our first two speakers have not yet arrived.
Okay, so let's do
yes,
that.
let's do that. We do have some.
Sarah is here.
Yeah, Sarah's on. Sarah Steenhausen, would you like to introduce yourself?
Oh, yes. Good morning, everyone. It's wonderful to be here. My name is Sarah Steenhausen. I am with the Division of Policy Research and Equity at the Department of Aging. And just want to extend a sincere appreciation to all of our members, as well as, of course, our chair, Catherine Breakmore, and our new co-chair, Dr. Wynn Canio, and a huge welcome to our new representatives on the committee. Super impressed by the work of this committee and the way that these meetings have been so effective at elevating issues and addressing spaces where we really need to highlight the needs of people living with Alzheimer's disease and related dementia. So thank you for all of your work and look forward to learning a lot today.
I think Julie might be here.
Juliet? I have not seen Juliet. Darcy's here.
Okay, Darcy, how about you introduce yourself?
We have Adam Willie. Darcy.
Hi, good morning, Darcy.
Hi, everybody. Sorry for the informal look, dealing with a sick child, but so good to see everyone. Darcy Delgado, Assistant Secretary for California Health and Human Services. My portfolio covers Department of Aging as well as a few other departments. And my colleague, Julie Soulier, who will be joining in a few minutes, works with Department of Public Health. And so we are here to represent Secretary Mark Galley and his continued interest in all things related to the topics that we're going to be discussing today and the topics that this committee covers. Just thank you all for your time, your energy, and your effort in this space. Just really excited to be here. Thanks.
Thanks for the nice welcome, Darcy. We always appreciate you and Sarah and everyone else that supports this committee. Anyone else we should introduce?
We have Adam Willoughby. Yeah, Adam, if you're on, you want to introduce yourself?
Yes, hi, thank you. And good morning. I'm Adam Willoughby. I'm serve as the Assistant Director for Legislative Affairs at the Department of Aging. Happy to be here. Looking forward to the conversation and in particular, the legislative update that's coming on at 1:15. So thanks very much.
Thanks for joining us and bringing your wealth of information.
And we have Carrie Rogers. Carrie may be multi.
Good morning. Carrie Rogers. I manage the director's office here at CDA and looking forward to listening in today.
And we have another committee member, Celine, has joined. So
good, Celine.
Celine, if you'd like to introduce yourself.
Sure. Good morning. Sorry for my ineptness in getting into this meeting. I'm Celine Regalia. I am the Alzheimer Daycare Resource Center representative, and I'm with Providence Community Health in Napa Valley.
And thanks for pitching in later on. I think you're helping us with the emergency preparedness.
Yes.
presentation. So grateful for your expertise. Thank you.
Shortly. All righty, we have our fabulous host and co-host team. So Carol, you already met. Rosie, would you like to introduce yourself?
Sure, my name is Rosie Carvajal. I'm the Manager of Operations and Special Projects for the Division of Policy Research and Equity. Happy to be here.
Excellent. And every time you say next slide, Rosie is the person who will be taking care of that for you. And then Callie Clark, who's one of our newest members to the CDA team. Callie, do you want to introduce yourself? Callie might also be training while she's also doing that. There she is. Okay, Callie.
Good morning. Hello, I'm Callie Clark. I am the newest member of the CDA team with the Dupree team. That's all I have to say. Good morning.
Well, we think you've joined a fabulous team, and I want to just acknowledge Michelle Johnson, who's the primary coordinator for all of these meetings and lots of other things at the Department of Aging, and does a fabulous job for this committee. It's like runs very smoothly, and she helps get every panel pulled together. So we're just extraordinarily grateful. So thank you.
We have one more. We have from Department of Public Health, we have Lindley Stern. Lindley, do you want to say hi? Okay.
Okay, so I think the other thing we have to do is approve the minutes from the last meeting. And that meeting was in November. So everyone had a chance to look at those, and does anyone have any questions about the minutes? If somebody had a thumbs up, maybe. Yeah. Okay, so we've looked at the minutes. Is there a motion to approve the minutes from a member of the?
So moved.
Thank you.
Second.
Was that Todd?
Yes.
Thank you. And who was the second?
Sally.
Thank you. It's hard to see, or at least hard to. Okay, all in favor of approving the minutes?
Aye.
Aye.
Any opposed? Any abstentions? And I was not at the meeting either, so. Okay, thanks for that. And ready yet for our presentation? Okay.
Yes. So Rosie, if you could put the slides back up, please, for the, there we go.
Okay, so we, what we have done every year is have the committee members identify topics that they are interested in learning more about, or that they think are things that need to be elevated for a discussion among the committee. And one of those topics was emergency preparedness. We have a really terrific panel today that's going to talk about what is Department of Aging doing, what is Cal OES doing, what are providers doing? California honestly seems to be in a perpetual state of emergency. Just lots of things happening with fires and rain and floods and all of those things. So I think it's a very timely presentation, no matter what time of year we get to engage in that discussion. So really excited for the presentation. And are we going in order of the presenters here, or in some other order?
Possibly. So you all may have heard that there's been a little bit of rain this week. And
experience it.
Yeah, the California Governor's Office of Emergency Services has activated. So I'm not sure, Vance may or may not.
Vance is
Vance is
I
on?
just texted him.
Oh,
Yeah.
awesome. Wonderful.
Terrific.
So
we are all
everybody's
set then,
here.
right?
We are in order.
Terrific. So I will, you'll hear from each of the panel members. Their bios are in the materials that you have. So I want to spend our time talking about the topic and not reading through people's bios. But if there's something you want to say about yourself, or maybe just where you're from when you start speaking, that would be great. And we will have time for committee member questions and answers, and any discussion that we want to have at the end of the presentation. So with that, I'm going to turn it over to the amazing Celine, who's going to lead us off.
Oh, okay. I didn't know I was leaving this. I'm sorry. Good morning, everyone. I'm Celine. I'm the executive director here at Providence Community Health Napa Valley. Just a little background about who we are as an organization. We have our hospice program, palliative care program, adult day health program for 25 years, and we are in Alzheimer Daycare Resource Center since 1999. Recently added our PACE program in 2023. And so a lot of our, our programs and services, we are on call 24/7 to meet the needs of our hospice patients, our PACE patients. And Napa has had its slew, unfortunately, of disasters. We have had the earthquake, and then what came out of that is a COAD, community organizing and assisting in disaster. And it was really our local foundation supported that work to really leverage the work and the strengths of our community-based organizations, our nonprofits, of how to respond to disasters. So we were able to do assessments of ourselves as organizations. We formed this grassroots COAD that now is its own 501c3, and it has really changed the way that we respond to older adults. And another part of that is a subcommittee is we have a subcommittee that is adults with functional needs. And so a lot of the work that we've done in the community is looking at family caregivers, looking at people with other abilities, people with dementia, and what are the implications for that work. So, personally, with the fires, the multiple fires we had, the evacuations, it's difficult for any older adult who, in Napa County, we also have, a large portion of people living with a dementia diagnosis, over 3,600 people out of our $150,000 count, that 150,000 county residents in our county. And so as an Alzheimer Daycare Resource Center, during the pandemic and otherwise, our responses have really we've had to triage and educate, support our caregivers, and make it really ingrained in our process about how to be prepared, what to do, and the unique challenges. And so one example, we have a participant that had intellectual disabilities. It was during the pandemic. They were evacuated from Angwin because of the fires, and the mother was elderly with her 60-year-old daughter with Down syndrome, and they were in a hotel. And it was really, really, really difficult. And the center was closed at that time because we had to shut down. And we eventually opened because of some of the needs, and it really was related to a lot of our dementia participants and in absence of the center, the caregivers really needing respite, and especially in these challenging times. And so we were able to open up our center safely with just 10 participants, socially distanced. So that work has evolved, and what we're doing now in our community is creating a calendar of emergency preparedness. And what we're doing is we're training the caregivers, and I have my social workers in all of our programs, making sure that they have their go bag, making sure that they have their things, and then how can we support the caregivers? We also did something I think pretty unique and special in our community where with our local shelters, the COAD organized all of us, and we did a training around working with older adults in the shelter environment. And so we activities that you would do, how would you deal with some of the behavioral things around the dementia diagnosis if somebody had to evacuate to a shelter? So a specific training on how to work with older adults in the shelter environment when that can be a really chaotic environment. So this work continues to evolve. Our Alzheimer Daycare Resource Center manager is part of the Adults with Functional Needs Committee. And really, we're trying to bring our dementia expertise into the conversation so that they know how to support family caregivers and people living with a diagnosis in our community in a disaster. So that's kind of my anecdotal experience thus far.
Terrific. Thanks for sharing that, Celine. I think it helps set the stage about the importance of the collaborations that you mentioned and kind of how to meet things during an emergency. So I think our next speaker is Vance Taylor. I've had the privilege of knowing Vance when I was as the Director of Disability Rights California. He's been doing this work for any number of years and really brings a breadth of experience to all of this. So from Vance.
I appreciate it. Thanks very much. Hopefully everybody can see and hear me okay.
We can.
Excellent. Yeah, it's interesting. You were talking about there's always something in California, and of course there always is. But my plan was to be there with you in person. Unfortunately, we are activated in response to these winter storms, and so I'm finding myself being pulled into a barrage of meetings, most of which take place in our state operations center. But definitely glad to be with the group today, talking about what is absolutely a very relevant and very important topic. So I think at the start, it's important to simply say that, the Office of Access and Functional Needs exists for a specific reason. And it's because we have seen that there's a disproportionate impact anytime there's a disaster, regardless of what the disaster type is, or where it takes place, or the scope and the scale of the incident or event, but there's a disproportionate impact on people with access and functional needs. And absolutely that includes older adults. Absolutely that includes individuals with Alzheimer's. And what we've seen is that not only are they hit the hardest before and during an event, but also during the recovery process as well. And it's not that this disproportionate impact sort of happened on accident or for no reason. What we found in emergency management is that while unintended, individuals with access and functional needs were really left out of the way that we develop our plans to prepare, respond, and recover from disasters. And I always say emergency managers are what I refer to as salt of the earth people. These are individuals that run towards danger, right? Because they want to help people. But oftentimes in the field, what you've had is people with very similar lived experience. People who can walk and run and that don't have a lived experience with disability or with an access or functional need. And what happens is when you get people with that same lived experience or similar lived experience, and you bring them together to develop a plan, they don't know what they don't know. And so let me give you just a quick example. I use a power wheelchair, and I have for most of my life. And so anytime that I go into a room, I'm scanning that room for access. Is there anything impeding my path of travel? Are there steps? Is there a ramp? Am I able to get around? That's because my lived experience shapes my perspective, and so I look for those things, almost even at a subconscious level. If you jump, skip, hop, or run into that same room with me, chances are you're not looking for any of those same things. And that's okay. It's not that one perspective is good and the other perspective is bad. It's just simply to say that based on our individual lived experiences, we can look at the same thing and see it differently. And that's what we've learned in emergency management, is that in order to have plans that account and address the needs of all Californians, we have to have a diversity of lived experience and perspective around the planning table as we create those plans. And so that's what the office was developed to do, right? It was to identify what are the needs that all Californians have before, during, and after events? And then how do we, working in partnership with the community, how do we integrate and include those plans within the way we plan, prepare, and recover? And thankfully, through fantastic partnership with incredible organizations and groups, we've been able to make a lot of progress on that front. So, for example, when we look at the way we communicate, it used to be that to get information out, you'd say, well, let's do a press conference. But there was nobody there to say, hey, maybe we should have an ASL interpreter. Or maybe we should put this out in multiple languages. Or maybe we should use plain language, right? That's understandable at a third or fourth grade level. And so because those considerations weren't baked into our communication plans, you had this life-saving information that went out that told people what's coming and how to prepare. And it was unusable by large swaths of the community. And that translated into increased human suffering and increased loss of life. And so recognizing that those communication barriers exist, we've now worked to integrate our process. So just 2 days ago, when we set up our State Operations Center, before we had even stood up the Operations Center, we had phone calls coming in saying, let's make sure that we've got language services in place. Let's make sure that we've got ASL interpreters. And so if you see these press conferences, you'll see that they're accessible. And if you look at the information that gets posted online about these storms, whether that's on social media or other platforms, you'll see that it's 508 compliant. We look at the way that we support individuals at shelters. It used to be that shelters were not always physically or programmatically accessible. And we've worked very hard with our partners to ensure that we can address those gaps. Because when you go to a shelter, you've got to be able to do more than just get through the door. If I can fit through a doorway in my wheelchair, that's great, but that doesn't mean that my needs will be met. We now provide wraparound services, and our Department of Social Services are really great about this. And by wraparound services, what I mean is, think about it, if somebody shows up without their support network. If you need help with feeding, or toileting, or being transferred in and out of a cot, and there's nobody to assist you, then you go to a shelter and essentially you dwindle on the vine. And as a state, we've said that we're not going to let that happen. And so as local jurisdictions put their sheltering plans together, they're now legally required to address access and functional considerations within those plans. So, you know, we see again progress being made on these fronts, and we've got resources, like we've got an access and functioning library now, and that includes information about emergency alerts. It includes videos. It includes all kinds of what we refer to as AFN specific resources that are housed in this clearinghouse on our website that people can pull from and use and learn. And so more and more is being done. And that's, for us, wonderful to see. I will say that what we continue to find is that there's a cultural shift that has taken place within the state. we now think about these things on the front end instead of trying to address them on the back end. And that has made a tremendous difference. So I can't go anywhere and not tell a story. I'll share it quickly with you. That I've got kids, I've got 2 daughters. But if you've got kids, you know that they're just so different, right? Same household, but same parents, but just like they're from different planets. And for us, we saw that right away when my daughter, my oldest daughter was born. My wife was in labor for 23 and a half hours. And I'm embarrassed to say I didn't actually know that was possible. I've grown up watching these TV shows, and of course, on TV, they have the baby in an hour plus commercials. So 23 and a half hours later, I was like, oh my gosh, am I exhausted? My wife hates that joke, by the way. So when our second daughter was going to be born, we thought, hey, let's minimize our time at the hospital. And we'll wait until the contractions are really close, and that's when we'll go. And so we had a plan. We had a bag. We knew the route. We were all ready. And the contractions were 10 minutes apart. And we waited. And they were 7 and 5 minutes. And we waited. And when they were 3 minutes apart, my wife said, we got to go. And so we hopped in the van. And my friend Aaron was driving. We went to the hospital. And we were all good except for one thing. We lived in DC at the time. And my wife went into labor at 8 in the morning, right in the heart of rush hour traffic on a Thursday. And so we get on the 395, and it was like a parking lot. And it would have been faster if I would have gotten out of the van and sat my wife on my lap and driven her to the hospital in my wheelchair than to get there the way we were going. And my wife turns and says, I'm going to have this baby in the van. And I just thought, I'm not that guy. Right? I'm not that guy that you see on the news that they ask, sir, you delivered a baby in the van. How'd it go? And he's like, well, the adrenaline kicked in and I grabbed a shoelace and we made it happen. I'm not built for that. And so trying to figure out what to do, I looked around and I saw, amazingly, that there was a police car next to us. So I said to my friend Aaron, hey, roll the window down and let me explain what's going on. And I did, and I was articulate. And I think what I told the officer was, help. I think that's what I said. And he asked, would you like a police escort? I said, yes. And he responded with, and I quote, yeah, we don't really do that. And rolled his window up. And our hearts collectively sank. And my wife's getting emotional and I'm getting emotional. My friend Aaron's like, how'd I get roped into being here? And I think what happened was, a few moments later, the desperation that we were feeling must have oozed out of our vehicle and into that squad car, because the officer ended up rolling his window back down. And he said, I'm going to turn my lights on, stay on my tail. We'll get you there. And next thing I knew, we're bombing our way through downtown DC traffic, which, as a side note, let me just say, if you ever get the opportunity to have a police escort, do it. It was amazing. Told my wife, thank you so much for this opportunity. But she was not as excited as I was at the time. So we pull up to the hospital and the officer took off. I didn't get to say thank you. I don't know his name. Never even got to shake his hand. He left, we went into the hospital, and moments later, our daughter was born. And this kid's so funny. Every year on her birthday, like clockwork, she makes the same request. Tell me about how I was almost born in the man. And so I tell her the tale, right? So amazingly, time goes fast and she turned 16. And I'm telling her the story. And I found myself getting choked up. Because I'm looking at this kind, smart, capable, this beautiful young lady. And I couldn't help but think, what tale would I tell if it hadn't been for the right person at the right time in the exact moment of our lives when we needed them the most? And I share that with you because for all the good that Cal OES and other state agencies are doing to integrate and incorporate the needs of people with access and functional needs into the way we plan, prepare, respond, and recover, the real progress that we've made has come about because individuals like yourself, partners, are so dialed in and so committed and so willing to push and to stretch and to give on this specific line of effort. So I will say that given who you are, given what your role is, each of you, by virtue of what you do, has the unique opportunity to be the right person at the right time in the lives of the people that you serve. And the impact that you will have on their lives isn't just life-changing. It will, in many instances, literally be life-saving. So thank you for doing that. Thank you for being a part of this mission. And know that I'm available, my office is available, but to support you in any way, shape, or form we can. So with that, I'll turn the time back over, but thanks so much for letting me visit with you today.
Hey, thanks for joining, Vance. We appreciate that. I think there's a couple messages there about the importance of preparedness. And I'm glad your daughter was born safely, but I also have a lot of respect for your focus on meeting the needs, thinking about the needs at the front end. I think California has been a demonstrated leader about language access and providing services and shelters. And just thank you for all that progress. And we're now going to turn it over to the person sitting to my right, who is Sydney Schellinger.
Scavenger, but don't worry about it.
Introduced herself before, and I think it's just terrific that Department of Aging has a dedicated person to also think about emergency preparedness. So we look forward to hearing from you.
Thank you. I'm just gonna stand just because I feel weird presenting sitting. Anyways,
Plus you have an amazing dress.
I did. I really kind of stepped up for the occasion.
For those of you that might not be able to see, like it is a Valentine's heart thing, as best I could tell, with sparkly red shoes. So
They're matching shoes. They have hearts on them too. Not to my own horn.
my 5-year-old granddaughter.
Good morning. My name is Sydney Schellinger. I am the Emergency Services Coordinator for the Department of Aging. And I will say that I am so excited to be in this position. I've been in it for 11 months. I get my 1 year on March 2nd. I'm very excited about. And I have had the great opportunity to be building our program. to really just emphasize on the work that our local partners have been doing to make it more of a statewide connection and to build those partnerships like with Vance and with social services. For background, I come from Cal OES. I have about 6 years there, and I've worked on a lot of disasters, including working on the shelter task force for the campfire and working on the COVID response for many, many years. So with that, I kind of wanted to get into more details, which is on the next slide, of kind of what CDA is doing and what our response and preparedness looks like as we are developing our program. So these are our older adult programs that we have within CDA, which is our areas on aging, or our AAAs, and their services and supports, our California Caregiver Resource Centers, our home and community-based programs, which will also include our adult day health care centers, and as well as our long-term ombudsman program. My job is to work with all of these programs to make sure that they have some emergency plans, that we are preparing for disasters, and making sure that we can support all of our older adults, those with disabilities, and their family caregivers. Next slide. So there's going to be two separate things I'm going to be talking about here, is CDA's role, and then as well as some of our partner goals and our preparedness goals for right now as well as for the future. So some of the main things that I do here at CDA is we are reviewing our partner emergency plans to make sure that they're up to date, and they're including specific things for the region, specific disasters, rain right now, as I am also activated like Vance is for the Priority Population Task Force, supporting our local agencies in that emergency preparedness, helping them provide trainings, helping them have specific, like the least dose kits that are available, and then also just coordinating those efforts with local partners, making sure that they are building their own networks, which is going to include working with their local emergency services coordinators, working with maybe public health and social services so that they can integrate into those local plans that are already there. And as I said before, communicating those emergency resources and preparedness information. A lot of my job is really just to be that support network, so that as the state, we can support our locals as they are going through any sort of emergency preparedness response, and as well as recovery from disasters. Next slide. So this is kind of our framework development. It's on 2 slides for emergency preparedness. So one of the main things that we're doing is the assessment and planning. So this is going to be not only at the state level, but for our local partners. And these are some of the things that we are working on developing and making sure that they are doing. A lot of our partners are doing almost all of this already, and we are just there to integrate things that are maybe being done successfully in one area and promoting it in another, and making sure that across the state that we have a successful emergency preparedness response and recovery program. And so that's going to include assessment and planning. So assessing the specific needs and vulnerabilities of our older adults and their caregivers within the community. And that is going to include reviewing those local emergency plans, integrating there, making sure that those resources are being done. As Vance talks about, sometimes certain people don't see what another person can, that can help enhance a plan to make sure that we are supporting every person and anything that they actually need. And developing those specialized plans to address the unique needs of the older adults and their family caregivers. Education and outreach. So conducting that outreach and educational activities to inform older adults of emergency preparedness, the importance of a personal preparedness plan, really focusing on the fact that, like, as the state and as the locals, we can only do so much, but the individual person preparing for a disaster is really the best thing that we can do. And so encouraging that education and focusing on that whole community so that we can identify people who can support you during a disaster if the state or county can't reach you in a certain amount of time, making sure that those connections are being made ahead of time so that you have a go kit, where local shelters might be, just making sure that we have that preparedness ahead of time, because the more you can prepare, the less stressful a disaster will be. As we've kind of talked about, California is in a constant cycle of disasters. I wish it wasn't the case. But so the most that we can do is just to be prepared and making sure that we are taking that extra step. So when it does happen, it is not as stressful. And then on the next slide is some of our other frameworks that we are working on, which is part of that is coordination. So collaborating with our other government agencies, nonprofit organization, community groups to coordinate the efforts, like our local caregiver was talking about, the COAD, which is community organizations active during disasters. And there is also VOAD, which is your volunteer organizations active during disasters. Those are groups that can also support our local agencies to make sure that they are, doing those wellness checks, that they are prepared, making sure they have preparedness for at that level. So building those partnerships. Our next speaker will also be talking, which is with social services, about some of the stuff that they do at the shelters and that education piece as well, which goes into the shelters. We at CDA and our aging supports are not the main point of contact for shelters. That is usually social services and that person at the local level. However, we do usually support our shelters, making sure that our older adults are being supported if there are any unmet needs there, bringing that to their attention and things like that. But these are also some of our frameworks that we're working on to help build that connection. And then when that comes to preparedness, making sure that we are part of the planning process. As Vance was talking about, going into a room, seeing if it's accessible, making sure that, when you are in a shelter, it's cots, making sure that that is accessible for the specific person, if there are unmet needs there, making sure we have a certain percentage for a population, because sometimes it's hard, the beds are really close to the ground. So like getting on and off of them and things like that, just making sure those concerns are aware of, so that our local agencies can help plan to prevent those things from happening during a disaster. And on that same thing, resource allocation. So securing and identifying resources to support our older adults, family caregivers during emergencies. This before a disaster can really help make that conversation good during a disaster. So if our local agency offices, things like that, can really talk to their local OESs to identify what resources might be needed during a disaster. If you have that discussion with your caregiver of what I might need during a disaster, having that ahead of time will help make it easier so that you guys aren't looking for the same PPE as everyone else, right? If we use COVID as the extreme example, just identifying those resources so that we have them ahead of time instead of during the actual disaster. And with that same thing, emergency communication, informing older adults, those with disabilities and their family caregivers about vital information before, during, and after a disaster. I am constantly sharing out information about certain weather reports when we come to fire season, a fire preparedness kit, today I sent out a whole new thing about all the least dose information for the atmospheric river that we're having. So sharing that with our local partners, and then as CDA, we are all putting that on our social medias. We are making sure that we are directing people to the Cal OES and least dose page. So this constant communication is there so that we are doing that preparedness effort here at CDA with our partners. And so those are our kind of 7 frameworks that we are working on for emergency preparedness here at CDA. And then on the next slide, we'll kind of talk about what my role is during a disaster. So during a disaster, I am part of the Priority Populations Task Force and the State Operations Center. So Vance and HHS are the leads of that priority population. And our whole goal is to elevate any issues that are happening. It's basically all of the entities that might be involved in supporting our access and functional needs community. There's a whole host of us, and we really just share resources, things that might be available for one agency that we might have an unmet need for with a different one, and sharing that up and making sure that we have that connection. So every day I'm sending out emails to all of our local partners, seeing if there are any unmet needs, what resources are coming out of the Priority Populations Task Force, and how we can support them at the local level. Because with disasters, everything happens at the local level. At the state, we are just there to support because we are not the ones actually experiencing it. We are the ones that are here to support you guys to make sure that everything is being done at that specific thing. We are also, as I said, sharing all applicable information, supporting our local partners with their evacuations and relief efforts. So these are the things that our local partners are doing as well. We are all here to support everyone to make sure that they are getting this, if I say support again, what they are getting during a disaster so that they are not experiencing any additional stress during this extreme time. And so that will also, next slide, as we're going to kind of highlight again, as one of our main roles is that communication and information. So we are disseminating that timely and accurate information for all of our participants as well as our partner agencies. We communicate and support our aging network before, during, and after a disaster. That is also going to be including like when a disaster happens and we get any sort of state of emergency. So when the governor declares a state of emergency or when the federal government declares something, sharing that information and the resources that are then opened up at the state and federal level for reimbursement and things like that. Making sure that we are supporting our local agencies so that they can provide as much needed efforts to their participants as possible. As well as providing emergency contracts, resources, support services for older individuals and their caregivers. So next slide is just kind of an overview of what our program is doing moving forward. And I say our program, I am a party of one. So I'm very proud of what we have established so far in my 11 months and really am very excited moving forward to just integrate all of these sort of efforts to make sure that we do support everyone, because as it is known during previous disasters, this is definitely a population that needs that additional help, needs that additional, those additional resources so that they can prepare, evacuate, and respond to, make sure that they are responding to a disaster correctly. So we are focused on building our emergency management capabilities, supporting our local partners, and preparing older adults, people with disabilities, family caregivers, prepare, respond, and recover from disaster. And this also includes a lot of partnerships, as I'm sure I mentioned before, a huge partnership with Cal OES, with all of our HHS partners. We are constantly meeting monthly, actually, with our HHS partners so that we can really share those resources and support these communities. I did provide some helpful information. So we have our CDA website on emergency preparedness. We have the CALE line, which is going to be an email that you can, phone number that you can use. It's the California Assistance and Information line. If you call that, you'll be able to be directed to the resource that you need at the time. We have our Ombudsman's crisis line. So if you are in a program like that, you can call them and be able to get any sort of resource that you need, as well as the LISTOS website, which has amazing resources for just the average Californian to prepare for disasters. They're very beautiful. There's tons of graphics. I love it. I can't tell, you can't tell, I love color. So those are the kind of resources that we have here at CDA. We definitely want to build this program. So any information that you have or things that you think about, definitely bring them our way and answer any questions that you have at the end. But thank you so much.
Thank you so much, Cindy. That was really helpful information, and I think you've accomplished a lot in 11 months. So
Thank you.
We're all grateful for I think our last presentation is really an important one because it's about the Department of Social Services. So I think has, as was mentioned, the responsibility for shelters in part and other licensed facilities, I'm guessing. So we're really pleased to hear from Michael, is it Boutier?
Boutier, very good, close enough. Hi, everybody.
Thank you, Michael.
Hi, everybody. My name is Michael Boutier, and I'm with the Department of Social Services, and more specifically in the Disaster Services branch. And part of the reason I am here today is to talk about the Functional Assessment Service Team. And so, as mentioned, we do have the lead in ESF 6, which is mass care and sheltering. And within CDSS, we have multiple volunteer programs. We have one that focuses on shelter operations. We have a redirect program that also, when we run out of resources, every state worker becomes an emergency volunteer. But more specifically, like I said, I am going to get into the Functional Assessment Service Team overview, or commonly known as FAST. And so we can go on to the next slide here. FAST was established in 2007, and this was an outcome of Katrina. Hurricane Katrina, and seeing what happened within the Superdome and during the sheltering aspect of things, California realized that they did not have anything in place to support people with access and functional needs or disabilities in that mass care and sheltering situation. And so back then, a group of folks got together to talk about what are the proper ways and next steps that we can implement something that will help people with access and functional needs and or disabilities when they do evacuate and go into a sheltering situation. And so FAST within California has both state and county programs. At CDSS, we are the lead for the FAST program. And so that ultimately means that we help or we train and certify the state volunteers. We also train and certify county volunteers. But once the county volunteers are trained and certified, they actually go and report to their local operational area or the county itself, depending on how it's set up. At the state level, like I said, we manage and oversee the state program, but also partner closely to help the counties establish their FAST programs if they so decide to do that. And so basically what FAST volunteers do once they are certified, they deploy to shelters. And they actually will be a team of folks who are in the shelter, and they go from cot to cot to assess the needs of the clients that are living in the shelters. And they do that by working through, and I'll talk about it a little bit later, but working through an assessment process that addresses the different needs of people within that shelter to make sure that they can live independently while they are evacuated from their normal living situation. Right now, we have a pretty small but mighty team at the state. We have a total of 60 volunteers that are active and certified. And then in fiscal year 23-24, we have trained 110 plus county volunteers. So, but if you think about it, we have 58 counties within California. So that means we don't have a very large number of FAST volunteers. And that could be based on the fact that some of the FAST volunteers do have a specialization when it comes to the requirements to become a FAST volunteer within the program. And so that last bullet point that you see there, it really comes down to if the county does need help, and we are activated, so they are going to go through their proper channels to request FAST, and that at the state level will go up through the SOC that will ultimately come over to our team at CDSS to help with deployments to these shelters when it comes to the support from the FAST volunteers. We can go on to the next slide. And so some eligibility requirements within the FAST volunteer program, and this is both for state and county. But specifically here we say you must be a current state of California employee. That's to be part of the program that I run at the state level. At the county level, it's going to be different. They can decide who they would like to have as FAST volunteers. And so, but there will still be some standardized eligibility criteria. And first, the volunteer obviously has to have approval from who they report to. And this is the big one right here. The third bullet point is the 2 years of personal or work experience within supporting the access and functional needs community. And that can be based upon lived experiences. That can be based on they work in that community and support. It's just a matter of that they have to meet that minimum of 2 years because they do a little bit more specialized work while they are at the shelters in support. There also is a Department of Justice background check because they are working closely with other people. They do have to pass that background check to become part of the program. And then the FAST certification course. There is a 2-day course that all volunteers have to attend and complete. There is a certification test at the end or assessment at the end to make sure that they, check for understanding and they understand what their responsibilities are. And those are the basic eligibility criteria for the program. And then counties can adjust as needed as they see based upon the requirements that they have in place for their own local programs. To the next slide. So when we talk about the FAST volunteers and the skills and duties, and basically I had mentioned the 2 years of working with people with disabilities and or access and functional needs. That's the bare minimum. But when they are out there in the field and when they go through the training, we really talk about the flexibility and creative problem solving that they need to have while they're on deployment. Not every resource is going to be available at the shelter when we have our clients come in and we're there to support them. So there might be some quick creative fixes to eliminate any sort of immediate situations while they're still working within the process to identify and actually request resources to come in and then be given to the client so then they can, as I mentioned earlier, live independently while they are within the shelter. That is the main focus of FAST. They are there to be the liaison between whatever the client needs to work with disaster health services, with mental health services, and to follow the proper chain of command to ultimately get the resources that are needed for the client. Also need to be able to communicate effectively with all levels of staff and the shelter residents. This is a very personal type of position that people take on within the FAST. They learn a lot about the clients that are living in the shelters. They also have to be able to communicate exactly what the needs are. So we talk about the importance of chain of command and how important it is that they act professionally at all times while they are deployed on behalf of FAST. And then some of you may be familiar with the CMIST framework. And CMIST, you can see the graphic down below. It talks about communication, maintaining health, independence. It talks about support and safety and transportation. And as I mentioned prior, what happens is we have the FAST volunteers who go into the shelters and they work directly with the clients. They go cot to assess. And so there was a CMIST form developed that identifies the needs within those different categories, the 5 different categories that you see in CMIST. And that's how our FAST folks are going to assess the clients to make sure that they have what they need. Based upon their evacuation, they may not have been able to get out of their house or home with their durable medical goods or anything of that nature. The CMIST form is what we train our FAST folks to use while they're deployed so they can hit all of the major categories that somebody may have as an access and functional need and the resource that we may need to provide for them. If you are interested in that and you have not seen that before, you can Google CMIST and the information in the framework will come up and you can get into it a little bit more deeply. There's a great overview out there within on the internet and supporting CMIST. We can go to the next slide, please. As I talked about areas of expertise, these are the things that we ask people to come in with. So this is a list of the different areas of expertise that people who want to volunteer will have in there as a background. And it doesn't have to be all of them. It could be a total of 2 years across the different areas of expertise that you see here. We do not train people within these areas of expertise. That is what, as I mentioned, they come to the table with, And then based on their history and their knowledge, they go out into the shelters and they use that CMIST and they apply their areas of expertise to then partner very closely with whomever it is in disaster health, mental health, disability integration, depending on how the shelter is set up. So in this case, let's talk that somebody, one of the FAST folks identifies somebody who may have a mental health disability. It is not the FAST members' responsibility to help that individual as a personal attendant. It is the FAST person's responsibility to then go to the proper partner, as I mentioned, mental health, disability health, and disaster health services. They will, after the assessment, work with them to say, hey, we've identified this. This could be a possible resource solution. This is what I'm understanding. It's time for you as the expert to come back in, and we'll just use American Red Cross as a partner. The American Red Cross person would then go sit and assess the client as well. So you can see our FAST folks have a very tight swim lane that they stay in because of their specific role and how they fall within the chain of command when they are in a shelter and supporting. The last slide that I'm going to cover is some of the limitations within the program itself, and you can go to the next slide. So as we know, and Vance had mentioned, I believe he said, volunteers and emergency management folks are people as salt of the earth. Well, you know what? We want to help. We want to get out and support, but we have to make sure that volunteers understand they don't self-deploy. We, as I mentioned earlier, have a process that we have to follow to then, where as the state FAST coordinator, I will reach out and deploy folks. That's part of my responsibility. And so I mentioned also the swim lane that is very specific to what FAST members should do and can do while they are deployed. We have had situations where within the shelter that our FAST volunteers have been asked to be shelter managers, behavioral health workers, therapists, medical personnel. That even though they may have the daily title of registered nurse, they shed that title when they are in the shelter. So as I mentioned, a registered nurse, they are not going to make the diagnosis. They are not going to provide the full support of getting, of being the personal attendant, so to say. They are going to partner within the program and within the disaster health services that I mentioned. So it's a very fine line, and it's hard to stay within those swim lanes, but it's so important. And then overall, FAST is there to basically support the clients that are there, to let the clients know that they have somebody that they can rely on, and to help the people with access and functional needs to be able to feel safe and confident living in that shelter situation. So this program is wonderful. I'm happy to be a part of it and to support our volunteers both at the county and state levels. We are making a difference and helping provide some of those wraparound services to welcome anybody and everybody into the shelter as needed. That is it for me. On the next slide, there is an email that if you do have questions regarding the FAST program itself at the state or local level, you can email disasterfast@dss.ca.gov. And that is my overview of FAST.
Thank you so much, Michael. Really informative and lots of, I think, interesting information about how FAST works and both the strengths of the program and the limitations of the program and how it coordinates with others that are doing work in shelters. So thanks for all your good work coordinating that and for sharing that information with us. We have come to the time where members of the committee get to ask questions. So let's just start in this room. Go ahead. Or
So thank you to everyone for all of the presentations. I just feel compelled to note that there was nothing specific to Alzheimer's and dementia in any of anybody's comments. And I don't know if, I'm not sure exactly what that's reflective of. I would say that my experience in talking with, certainly within LA County, and being in meetings with other counties when we're talking about emergency preparedness, what I have heard in the past is that there aren't necessarily a lot of materials out there that speak directly to the needs of people who are living with some kind of a cognitive impairment. So I was really excited to hear your assessment process that you're going to be going through. And what I hope it results in is some kind of a best practice guidance for counties on what specifically needs to be there to meet the needs of people who are living with a cognitive impairment, Alzheimer's, or another form of dementia. I'm sorry, Vance had to drop off our call because I'd love to see the governor's office be a hub for that sort of information as well, so that counties can go to them if they want to get some guidance about what should be in their plan to meet the needs of people living with a cognitive impairment. And I'll just give you one example, and this actually relates to what I'm going to talk about during the legislative update as well. Something we've talked about in LA County is the concept of a voluntary registry. And we've talked about it in the terms of wandering, but this absolutely relates if we're going to talk about emergency preparedness. And I think these things may be happening sort of ad hoc on not even a county basis, but a community to community basis. But if I had a magic wand, what I would be doing is waving it and creating for every county some sort of centralized voluntary registry, so that if you want to, you can put information on your loved one in there, and it could serve dual purposes. If they wander from home, we can get information on, current pictures and information, so we can find them. And if there's an emergency, we know where they are, and we can, and again, my magic world, send appropriately trained staff to their home so that we can get them safely out of that emergency situation in a way that's going to minimize anxiety and stress for those individuals. So this thread I have to carry through to training. So those first responder folks, I mean, who's showing up when there's an emergency? Is it fire? Is it emergency response? What kind of training are those folks getting specifically when it comes to people living with a cognitive impairment? So we passed legislation a few years ago that required first responders to get some training, not just on the medical specifics of Alzheimer's and dementia, but communication tips. How do you, if you're showing up as ER, how do you talk to someone who's living with a cognitive impairment? How do you make sure you're appropriately engaging their family caregivers? We've heard, unfortunately, stories of ambulance shows up and the family caregiver is trying to explain what's happening here. And the ER folks are saying, ma'am, I need you to step aside. And they're going through their protocol with this individual who has a cognitive impairment and can't answer these questions. And it proved to be very difficult to implement that legislation because of how just decentralized the emergency response system is. I mean, it really is a county by county system. But so I would love us to maybe, I don't know if we could get CalEMSA here in a future meeting to just explain to us, like, how does this decentralized system work so that we can set a floor across all of these counties so that we make sure that the staff that are responding have the right kind of training, again, on how do you talk to someone with a cognitive impairment, how do you engage with their family caregivers, as well as supporting counties and ensuring that their emergency planning includes some sort of component, best practices for people with a cognitive impairment. And if we can do anything to support counties creating these sorts of voluntary registries, I mean, no, I'm just dumping, but I had to sit here through all of these like
recommendations from you for.
Yeah, I mean, I think that the state has such an important role to play here, and I don't want us to get lost in the larger world of disability. I've heard so much great stuff about physical access and your comment about cots being low to the ground, and that's all true, but I need to hear something that's specific to our community.
So I'm going to ask a question, which I had, was just builds on what you did, but when I was listening to the presentation, I at the same time got a like where there's an atmospheric river from the director of the Department of Rehabilitation, and he provided a link to it's called a toolkit for people with disabilities that they can use during emergencies, ideally before. And so my question was, like, that's interesting. Is there a similar toolkit for people with older adults and specifically those with Alzheimer's? And if not, could it feels to me that a lot of the information in the toolkit for individuals with disabilities, which includes people with cognitive disabilities, could be transferable. And so my question is, does such a toolkit exist? And if not, if anybody planning to do one, which
Can
I
I
think
just
goes
say,
to a piece of your comments.
I opened a link from the emergency preparedness website to the Red Cross Ready for Disaster Preparedness Toolkit. It has nothing.
I'm talking about one from the Department of Rehabilitation.
Yeah, no, I'm just saying, like, this is the resource that's listed on the state's webpage, and it's
Okay,
again,
so the question that I'd like to see if any of the presenters have information about is there currently a toolkit? Are there plans to develop a toolkit? Like, and then if, you know, then we can make a recommendation around some of the things that are raised. So.
We currently do not have one specific to people who do have like cognitive impairments. We are working on creating a personal emergency plan for older adults, and we are definitely going to be including those with cognitive impairments as one of the like specific regions and extra things to look for if that is an issue. Do you know there are some counties that do have some specific things regarding like Alzheimer's and those with cognitive, like specifically San Diego County has like a police program that they've built up where it's a partnership where if they do know that someone does have Alzheimer's, they send in a specific task force to like support so that there is not as much confusion. And I do know that's kind of been like a spotlight and things to, it is, as you said, a local thing. It is at an individual level, but at the state, we are trying to make sure that other counties and our AAAs and everyone is aware of them so that we can hopefully make it a statewide like threshold, but we are currently working on adding those sort of things.
That's great. And I think I will send to you the Department of Rehab toolkit, just because I think it's an interesting place to start if you don't already have it.
Yeah.
Perfect. Other speakers have information about any?
Well, I would just like to comment. Thank you so very, very much on what you have just shared with us. As a person living with the disease, this is very near and dear to my heart. I myself have not had that experience, but our aunt had that experience where she had not been diagnosed with dementia, but she was in full dementia, and she lost her condo because she forgot to pay the association, and because her daughter is a special needs person. So she didn't have anyone to help her, and she was literally left out of her home. She was all of her everything was just thrown on the street, and she was left to herself. So thank you very much for what you're doing for people like me.
Is there, thank you so much for adding your wealth of experience to the conversation. Appreciate it. So a reminder, this is Catherine Blakemore, and there was a good reminder from Michelle that if we're in this room, we need to say our name before we speak, because I don't think people, all they see is it looks like a table and maybe some bodies sitting in some chairs, but I don't think they can read our name tag. So are there other questions or comments from committee members? Let's go to people that are participating by Zoom and see if they have any questions.
This is Celine. Oh, sorry.
Hi, go ahead, Celine.
No, I was just spot on with your comments, Barbara. Because of the work that we do, we're able to work, individually with our family caregivers that are caring for somebody with a diagnosis. And so it's really, and we're weaving that into all of our assessments and reviewing it at reassessments and really hardwiring it, because it's, as people stated, it's a year round. And so I think also as we're looking at, guide in some of the new initiatives that are coming. It really needs to be woven into, care management, that emergency preparedness is one of the things that needs to be assessed, and really helping caregivers come up with the plan and the resources that they need to navigate those situations.
Thanks, Celine, for adding that dimension as a piece of care management generally. So it's kind of a primary place I think people get information, and helpful to think about that in addition to the emergency services component. So thanks. Other comments from members on Zoom?
Yeah, I have one from Bill Mobley here. I'm sorry. Go ahead, Sarah.
Oh, no, you can go ahead.
Okay.
Yeah, just a related comment is the very great. Shall I continue, or?
No, we were just going to say, can you just say your name? Because at least I know who you are.
Yeah, Bill Mobley. Just a related comment. The risk of wandering and the risk of people lost while wandering is quite real. Whether during a disaster or just in normal times. I'm just wondering, are there teachings for caregivers and for first responders that have been put forward so that they can know exactly what they're dealing with and how best to manage that situation? It's a question for any of our speakers, but really any member of the panel.
Probably take
Thanks for that point. Let's just take the other question from Barbara had. Oh, okay.
I was just going to respond if nobody else wants to respond to it. Yeah, so this is Barbara McClendon. So Dr. Mobley, the short answer to your question is no. If you look across all 58 counties in California, very, very few have any sort of centralized response program for wandering. And that includes helping families prevent it in the first place. So I think there's a huge role there for educating families on how to prevent someone from wandering. And then there is an equally large role in how to coordinate first responder, law enforcement response when they do wander. So I think there's, again, love to highlight this in the recommendations we put forward to the secretary, but I think there really hasn't been a focused effort to address wandering at the state level. And Dr. Mobley's right. I mean, 60% of people with Alzheimer's or a form of dementia are going to wander at some point, and nobody thinks their loved one's going to wander until they wander. So it can be hard for physicians to talk about it. It's like families are taking in so much information, that one just kind of doesn't always stick. So we need to support families. Our systems need to support families. And so, we have a lot of work to do in this space.
Thank you. Thank you very much.
I think there was Sarah, did you have a comment?
Yeah, I just first wanted to thank the presenters and on this really important topic given where we live. And also just to amplify that it is really important to have a specific plan for those that have cognitive impairment, since there are, very kind of specific approaches that are helpful there. And similar to Dr. Mobley's comment, I had a thought too about just as part of the evacuation plan, making sure that individuals with cognitive impairment and their caregivers stay together and are not separated is really important.
Yeah, thanks for that helpful comment and information as we're thinking about kind of next steps the state can take. Todd, I think you had a comment.
Yeah, just real quickly, I thought I'd give you all some perspective from the field. As a licensed assisted living community, all licensed RCFEs in the state of California are required to have a 610E, which is a facility disaster plan that has to be outlined as to who's in charge when a disaster kicks in, there has to be a specific plan that is in writing and updated on an annual basis that the LPA that comes into the building and surveys once a year takes a look at. In addition to that, we're also required to have a emergency exercise once a year, and it's a good opportunity to be able to simulate how you would evacuate a facility, even if you don't physically evacuate. You go through the motions and you practice that, similar to what you would do in an earthquake response training. And so there is some practical information that is in every RCFE that has to be applied and has to be evaluated on an annual basis. We evacuated a 70-person memory care facility in 2014 in San Diego County during wildfires to another community, a sister facility. And there is a good network that have been set up between RCFEs in San Diego County because of that activity. There were multiple facilities that had to be evacuated for, ours was fortunately only 24 hours. Other people were evacuated for 2 days, 3 days, 7 days. We've also taken in residents from other facilities in Orange County during evacuations. And so I can give you some sense of comfort that there is a network between RCFEs, and there are protocols that have been established to be able to do that, that can be modeled to other, I think, communities and other networks. The other thing I want to highlight quickly related to San Diego County is there is a robust Take Me Home program that is overseen by the Sheriff's Department. We have participated in it. We have sat in planning meetings and educated first responders. And it's the only one that I know of in the state that is active, and a great model that could be applied across the state of California. And it is a response for anybody that's been wandering, anybody with intellectual disabilities, autism, dementia, and it goes into action anytime a lost individual is reported. It goes out on emails, it goes out on text messaging, and they've had some great successes.
So thanks for the information about what happens in facilities and for also the information about the wandering program in San Diego, which seems like it might be a perfect topic to sort of jumpstart that conversation. So thank you for that. Dolores, I think you have a comment.
Yeah, thank you. I was curious about the mental health aspects. So when Michael Boudier was talking about the FAST team, I wondered if they assessed mental health at all. So specifically that team, but also more generally, people with dementia and their caregivers often have mental health issues as well that are related to the dementia or maybe part of it, but need their own attention. You know, for example, depression, anxiety are probably the two most common. But they can make it difficult to manage the person if their depression and anxiety and any others like that are not recognized and in some way responded to. So I wondered if we have any mechanism in the state. It sounded like maybe the FAST team was the closest, but I didn't hear Michael say that they did assess mental health. So 2 questions, do you, as part of that, your work, do that particular function? And if not, could we also have that as a possible recommendation that we assess mental health and try to provide some assistance for people who are struggling, particularly with anxiety and depression? Could be the patient, could be the caregiver, could be both.
Yeah, so great question. And mental health is definitely something that, especially with the 2023 winter storms, FAST was deployed from January, and the final FAST person went home in early July. So they are out there supporting folks within the shelters, even after the event, into recovery and such. And mental health came up quite often during the deployments. And so, as I mentioned, it's not the FAST volunteers' responsibility to basically diagnose, but they will interview, they will assess, they will identify something that's going on. As you mentioned, depression or something else from a mental health standpoint. Then at the shelter, there should be a mental health representative. And so then that way the FAST person would say, hey, we've identified this situation and it's this person. Here's what the conversation was about. Here's what I think is going on, because some people will have a background in mental health being a FAST member. They will then pass it on to the person who is there to support from a mental health standpoint and as their expertise and what they are deployed for. So all that does come up. There are questions or opportunities within the CMIST framework that help FAST members ask the appropriate questions to then pass on to the expert that has been deployed to support in that capacity. Does that help?
Yep, thank you very much. And we unfortunately need to end this discussion so that all of you can take a lunch break. Fabulous questions. Just continue to think about this, because when we get to the sort of recommendations to the secretary, I think there's a nice thread here that we can pull out. I'm going to ask Barbara to put down her thoughts in a note so that we can incorporate those. And we will be back to hear from Susan at 11:55. So thanks for joining in the morning, and look forward to seeing you soon. And I think we're going to mute the Zoom. Perfect.
Well, welcome back, everyone. Yeah, so Susan is next. We need introduction, our Director of California Department of Aging, and thank you for being with us today.
Good afternoon, everybody joining on Zoom and here in the room at CDA. I wanted to start out with some happy news. We are celebrating our 50-year anniversary all year 2024. And we're spending a lot of time looking back at how things were very, very different 50 years ago, as we look ahead to what's in store for the state of California. So this is just a really exciting time to thank everybody who built up the network that exists today and established so many programs in prior governors and the legislature, model programs that California has. And then also a reminder to all of us that the next 50 years will look different too, and what are we doing to put in place to prepare our state for the demographic shift that's underway. So you'll have lots of opportunities to celebrate with us in 2024. And next slide. Michelle, how much time? 10 minutes?
We have until, we had about 15.
Okay, great, great. So this is not my preferred way of communicating with all of you, to have a slide that has all of these bullets on it. But a lot has happened since this advisory committee met last. And I wanted to just sort of tick through all of these items real quickly, and then make sure there's time for any questions that you might have or clarifications. So we're really excited that and Celine is on here, but that the first round of Bridge to Recovery grants have been awarded to adult daycare, adult day healthcare, and PACE, Program for All-Inclusive Care for the Elderly sites around the state. And we're finalizing those contracts and looking forward to getting those dollars out into the community. We have also formally established the state's No Wrong Door Governance Council. We received federal funding. We talk often about the No Wrong Door system, and absolutely a lot of emphasis on what needs to happen at the local level on the ground, but we are now working across departments and agencies on a state governing council that will really help bring this to fruition over the next several years. By now, I think you're all familiar with the governor's proposed 2024-2025 state budget. As a reminder, this is the starting point for the budget, and it moves through the legislature. We may revise every year, where we update any numbers, and then it's finalized. It is required to be finalized in June of every year. So we're at the very beginnings of the state budget process, and overall, older adult programs for people with disabilities and family caregivers fared well. We did not see any direct cuts, and there were even some minor increases to the home and community-based waiver and the assisted living waiver. So we're very grateful to the governor and to Secretary Galley for prioritizing health and human services. And in fact, the health and human services budget as proposed is nearly identical to the one in the prior year for general fund expenditures. We have launched the state's first statewide LGBTQIA+ older adult survey. It was launched earlier this month. It is open through the end of March. These links are in chat for you. We encourage you to promote it through your audiences and your constituencies. Older adults, individuals who are 50 plus can participate in this survey. Our goal, we're working with UC Berkeley, UC San Francisco, Open House, and a coalition of organizations. Our goal is to have 2,000 completed surveys, and we already have 1,800 in just the first 2 weeks. So please keep putting, getting this out through newsletters and websites and any communication channels that you have. Some of you followed the Little Hoover Commission. In the summer, they held 2 oversight hearings. The first was on the Master Plan for Aging, the structure and governance and impact of the Master Plan for Aging. The second was on older adult housing, preventing and ending older adult homelessness. They summarized the findings from their first hearing and released that report about a week or 2 ago. And we're just so grateful to the Little Hoover Commission as a fantastic partner. Many members of this commission served in the legislature. Several of them are responsible for some of the programs we have today and were real champions for older adults in their time. And it was very much in that spirit that they conducted these oversight hearings to see how can the Master Plan for Aging be strengthened and sustained to really have a cohesive, coordinated plan for our state. So I would encourage you to take a look at that report. We also just wrapped up all of last year. We had a steering committee made up of the California Association for Area Agencies on Aging, C4A, the County Welfare Directors Association, the California State Association of Counties, the California Foundation for Independent Living Centers, and the California Commission on Aging. We did an in-depth deep dive on the network of 33 area agencies on aging in our state. Extensive quantitative and qualitative data was collected, in-depth interviews with every AAA in the state, benchmarking against other states and looking at federal data. And we also conducted the state's first ever consumer survey of older adults. We received over 17,000 responses, and that fed into it. So that report came out just a week ago, and we're eager to get moving on those recommendations. It's really an agenda for action, and we're really looking to my earlier comment about celebrating our 50th year. What can we put in place today to strengthen this network to be more responsive to the changing, the growing number of older adults, more medically complex, people living longer, more housing challenges, behavioral health challenges, and how can we better align with the investments that have been made to date in CalAIM, in behavioral health modernization. We heard today from disaster planning and preparedness, and more. And then you'll see in the link, this is a priority to move on the recommendations made in the California 2030 report. This is one of the California Health and Human Services Agency priority programs for this year. And I would just encourage this group to really see where Alzheimer's, dementia, and family caregiving fit into those recommendations. and really inform us on how we can be more intentional in our work ahead with the AAA network. We also released the Master Plan for Aging. Our third annual report came out last week. We delivered that to the legislature and to the impact committee that has oversight for the master plan. And for those who are new to this work, every other year we update the initiatives. So this is a year when we don't update the initiatives. That coincides with the 2-year legislative cycle. So this year's report, lots of great information in there, but it does not include new initiatives. We're still midway through the last year's initiatives. And then last but not least, many of you have been involved in the work over many years, I think 5 years now, where California has really been exploring, what can we do to better support people in the missing middle, individuals and families who are just above Medicaid eligibility, don't qualify for Medi-Cal, even with the removal of the asset test, which we're so proud of, and who cannot self-finance their care, whether it's home care, adult day health care, or assisted living. So we're renewing our commitment to looking at LTSS financing, and we're going to be doing some work with some national partners to see what levers exist with the Medicare program and the Medi-Cal program and the private sector to really shore up support for the missing middle in our state, a growing number of people, especially as we see increased longevity and people are outliving their savings and their assets. So that's, did I take the whole 15 minutes?
You did great.
We have time for one question?
We have time for a few
Okay,
questions, yeah.
great. And I apologize, those who are in the room don't have access to the links, but we'll make sure that you get all of those links if you want to learn more about anything that I mentioned. Are there any questions, comments, clarification?
Committee members, you can raise your hand or speak up if you're on the Zoom.
A comment?
Yeah,
This is Barbara. I just want to thank you for the work, especially in that last bullet point about the long-term services and supports benefit, because I hear this from our care counselors regularly, where they've got people in front of them that are over the limit to qualify for Medi-Cal, but way under what you would need in order to fully self-finance this kind of care. And when they learn that there's very little, I mean, people don't know, right, until they get there, that these programs that they thought maybe they could count on are not going to be able to do for them what they think they are. And so it's just so important to be, I feel like, I know this is complicated, especially in a state as big as California. But I'm like, I know we have to talk about it a lot, we have to get it right, but I'm kind of like, look up at Washington State and I'm like, they're doing it. And I, hope that we get to some place where we can actually start really maybe launching something.
Thank you, Barbara. And a big piece of this work will include stakeholder engagement. So whether, we will probably bring to this group, some questions, and might even be on your agenda at one of your future meetings to really hear more specifically from this community. You'll be part of that work.
Great. Any other questions or comments? Any committee members on the Zoom who would like to speak? Great.
If there are no further questions, I will just ask to put in the chat that the Cal Grows effort and the IHSS career pathways are still underway through the end of this year. So I know this advisory committee cares a lot about workforce and training. So I would just remind you to promote that as opportunities for learning and stipends. So, if you can help us get the word out. There was a lot of attention when they were launched, and they continue through the end of this year. So great opportunity for training on Alzheimer's, dementia, family caregiving, and for direct care workers to get paid stipends to augment and to be paid for their training as well.
Any other comments, questions? Some portion of it. Okay. Are we, since we're ahead of schedule, are we ready for our next presentation? Excellent. So we're gonna turn now to the public awareness campaign. This is something the committee has been really excited about and given input at various different points and times. And I think it is about ready to launch and we get a preview of it, which is quite exciting. So we're gonna have that time to take it away and feel free to introduce yourself and provide any background and.
Hi, good afternoon. Can you hear me all right?
Yes, you're a little softer, so if you could speak a little louder for us online, that would be great. At
Okay,
least for me. Thank you.
No problem, no problem. Good afternoon, everyone. Thanks so much for having me. My name is Lisa Gonzalez, and I serve as the Communications and Prevention Lead for the Alzheimer's Disease Program at CDPH. I'm excited to announce that the Alzheimer's Disease Program has officially launched California's first ever Alzheimer's disease public awareness media campaign called This Is What It Takes. And I know that the committee has received a few brief updates this past year on the campaign's development, so it's great to be here to share that it has indeed launched. So today I'll be sharing some background information on the campaign's goals and timeline, and I'll also showcase some of our beautiful advertisements that we've developed with our media vendor that you'll start seeing in the market as early as this week. I'll also highlight our campaign's website that is live and accessible to the public and the resources it includes. The image you see here is a glimpse of our campaign website homepage that you will be seeing a little later on. Next slide, please. Okay, so our media campaign officially launched at the end of last week and will run through June of this year. So it will be very fast moving. The campaign has two main goals, which include increasing awareness of Alzheimer's disease and related dementias by educating Californians about who is most greatly impacted, prevention measures, risk factors, signs and symptoms, and actions that can be taken. Our second goal is to shift public perception and reduce stigma by combating existing attitudes and beliefs among our target audiences. The target audiences for the campaign include pre-symptomatic individuals and persons living with Alzheimer's disease, focusing on populations disproportionately affected, including women, communities of color, and lesbian, gay, bisexual, transgender, queer, and questioning people. Our campaign further targets these populations with English language messaging for multicultural audiences and Spanish language messaging for Spanish-speaking audiences. Our campaign is also inclusive of persons with disabilities. And essentially, our aim is to really empower individuals to understand how they can improve their cognitive health, recognize the signs and symptoms of Alzheimer's disease, and foster open conversations with their friends, family, and healthcare providers. Next slide, please. Okay, so our campaign's creative direction, I wanted to feature this a little bit just so you can kind of see how everything evolved on the development side. But the creative direction really centers knowledge as power, using simple factual information that helps people understand the disease, what to look for, and what to plan for. The tone of our images and messages were designed specifically to evoke empathetic and positive, powerful emotions such as hope, empowerment, and agency. Our broad strokes media strategy includes the following: paid media efforts that deliver dynamic, tailored messages effectively and efficiently through TV, radio, digital, social, out-of-home, and print placements. You should start seeing radio and digital ads this week and video broadcasting and print ads as soon as next week. Our own media strategy includes the campaign website or the landing page that we developed that our ads are driving folks to, where they can access more information and resources. Our public relations efforts will include both earned media and community outreach strategies that will span the months of February through June of this year. Our earned media efforts will include hosting regional media events in collaboration with our media partners, convening ethnic media roundtables or briefings with trusted sources and partners, developing bylines and op-eds for placement, and conducting ongoing earned media coverage monitoring. Our community outreach efforts for the PR side of things will include community-based organization partnerships to reach our target audiences and priority populations, including faith-based organizations, outreach to new and existing community partners and local health jurisdictions, and webinars, community events, and roundtables. So lots in store for this spring. And next, I'd like to show you some examples of our paid advertisements that you might have already seen or will start seeing soon in the market. Next slide, please. Oh, perfect. Okay, so here we have two digital ads that you might see on something like your computer or your mobile device. The ad on the left is targeting our age 45 and up audience and promotes awareness of early onset Alzheimer's and our call to action to learn more and visit the campaign website at the Learn More button. You'll also see our campaign logo and tagline, Take on ALZ, throughout. On the right is a Spanish ad targeting our age 65 and up audience that roughly translates to what does it take to take on Alzheimer's? Awareness of signs and early detection. See why taking on Alzheimer's is so important. Learn more. Again, with the button to click, that will take you directly to the website. So this is just an example of two digital ads, but you'll start to see several versions of these messages and images that are tailored for each of our priority populations. Next slide, please. And here on the left on this slide, we have one of our out-of-home ads that will be printed as a medical office poster and a Take One brochure that you might see at the doctor's office. The Spanish poster we have shared with you today delivers a message related to taking the initiative to talk to your doctor about Alzheimer's and shares some facts about the disease. And on the right is another version of a digital ad for the 65 and up audience that promotes the support that is needed from family and friends to talk about screening. Next slide, please. I think one more. But the next one is a print ad that we wanted to showcase for you all. Oh, there we go. Perfect. So this is targeting our age 45 and up audience. The message here will be adapted with images of each of our target populations and will be run in various publications and magazines, including LGBTQ, Spanish, Vietnamese, Chinese, Korean, and Japanese print outlets who serve communities where print materials are most effective. And I can pause here if anybody wanted to read the actual ad. Perfect. And then, of course, at the bottom, we have our call to action to learn more so that folks can visit our website. Okay, next slide, please. Perfect. Okay, so here's a look. This is just a kind of a screen grab of our beautiful campaign website where all of our ads will be driving the public to learn more information and access vital community resources. And you'll all receive the link to this site when the meeting slides are made available. So as you can see from just the image here, there are page tabs at the top to guide folks to specific topics related to Alzheimer's disease. But generally, the website includes campaign educational materials to inform audiences of ways to promote brain health, learn the signs and symptoms of Alzheimer's disease, connect with clinical and screening resources, and access resources for caregivers. There's also infographics, flyers, and fact sheets that will be housed here and available to download in the coming weeks, which will also be used in our earned media and our community-based outreach efforts. And additional materials that will be developed that aren't quite live and accessible just yet will include press materials and a digital toolkit for our partners to use and share within their respective communities. And our hope for the campaign website is really that it will provide Californians with access to vital community and clinical resources to assist themselves or a loved one with Alzheimer's. The information hub that we've created here on this website has really been a true collaborative effort and includes important information and resources from both the California Department of Aging and the Department of Healthcare Services. So we're excited for the website to really connect folks to the work that the Alzheimer's disease program is doing and the amazing services that are already being delivered by our funded community research and clinical partners. So this is like a real big nod to everyone that we're already working with and then inviting new partners on to join our efforts here in California. So we've got a lot of big hopes, and I wanted to just give a couple snippets of some of the creative and the images and the assets that you're going to see. And we can go to the next slide, please. So I'll leave our program's contact information here along with a link for our 30-second TV broadcast commercial. And then a gentle reminder that if you're not already following CDPH on its social media platforms, you can access them all here once you receive the slides. And then you'll be able to actually start seeing the social content rolling out and live next week and throughout the spring. And that's the last slide that I have. I wanted to make this as brief as possible to stay on schedule, but I just want to say thank you again for having me on the meeting today. And I can hand it back to Michelle, or if anyone had any questions.
So Lisa, we do have the video queued up to be able to show the 30-second.
Oh, go for it. Perfect.
This is what it takes to take on Alzheimer's. Awareness of the fact that nearly 2/3 of people diagnosed are women. Courage to accept that memory loss that disrupts daily life could be a sign of Alzheimer's. Dedication to lowering your risk by staying active and monitoring blood pressure. And support from family and friends to talk about signs, screening, and early detection. Take on Alzheimer's. Learn more about signs and screening at takeonalz.com. Brought to you by the California Department of Public Health.
Hey, thank you so much. I'm glad that we were able to show it. I wasn't sure if we were going to have enough time, but 30 seconds is pretty quick. Thank you for doing that for us. I hope everyone enjoyed it.
It was great. Thanks. Sadly, no popcorn, so sorry.
May I make a comment?
Please, go ahead.
That is just amazing. It is so wonderful. I love just the way everything was put together. It just makes it so real. You know, we don't want actors, you know, et cetera, et cetera. And these these people look like just regular folks. And I think that is just absolutely spectacular. So well done.
Thank you. Thank you. That was exactly what we were hoping reactions would be like. That's exactly why we chose the talent we chose for all the photo shoots and all the things. So thank you for the feedback. We really appreciate it.
Yes. And of course, you know, all of the people of different colors. So yay on that. Thank you.
Excellent. Thank you.
California, right? So
you got
that's really
the world, really. But
I think we have a few minutes left until our next presentation. So even though it wasn't on the agenda, if members of the committee have other questions or comments, we would love to give you the opportunity to ask.
And Lisa, I don't want to put you on the spot, but this group hasn't heard about the new research grants, so I can drop the link to the latest round of grants in the chat, but I didn't know if you wanted, on behalf of CDPH, wanted to say anything about those latest research awards.
Oh, yeah. It sounds like you already have the link. If you don't, I can throw it in the chat as well. And I can hand it off to Lindley as well, who's our program chief at the moment. She might have a little more context on the recently awarded research grantees, but those just were announced, I think, a couple of Fridays ago. So very, very new announcement for us. And we're very excited for the next round of research grantees to kind of get their projects rolling. So I'm not sure if you wanted to say anything specifically, Lindley.
Sure. So we recently awarded 7 new grantees under the Alzheimer's Research Grant Awards. It covers about 22 million across the state and awarding out to different academic institutions. I know Michelle shared the link in the chat that shows the list of the awardees. It covers everything from underrepresented populations, Native American tribal groups, in addition to Spanish-speaking populations, and really getting to the core of the diversity of California and the different types of groups we want to be learning more and getting more data information about. So we're really proud.
Great, thanks for sharing that and the links. I'm sure people will be very interested in that. I had just a quick question. I'm interested in the timing with this ending in June and sort of what happens after June. It seems like you've developed all these good materials, and are there other anticipated uses for them, or maybe just help us understand the timing and what happens next?
Yeah, so that's a great question. So for the things that everything we're creating, we're going to own. But it's just based on our funding and our ability to kind of reuse and recycle and place the ads after that. We'll have to kind of go back to the drawing board and see what we can do. But the website will remain live. We'll be doing lots of social media content pushing because we have all those assets and we can work directly with CDPH on our communications team to make sure those are ongoing and staying relevant and, you know, being used throughout past June. For the paid placements, that's where we might struggle a little bit and would hope for maybe additional funding down the line to help us really place those with the trusted, you know, TV, radio outlets. But we do see that as a challenge of, you know, what will happen, and we want to use this opportunity to really build momentum and then somehow keep it going. So there's certain strategies that we have control over that we can use our resources for, but there's some that we would need additional, you know, funding for. But we're excited to actually have these resources, like we were mentioning, the infographics, the toolkits, those we will have, and we will, you know, continue to use those with our funded projects, any new partners, and we'll do our best to kind of get the message out there as best we can. So that's what gives me a lot of hope, is that we have the copy and the content of literally everything, and it's just up to us how we want to get creative to kind of keep rolling it out, and partnering with other folks to get the message distributed past June.
And is there any data being collected about, you know, from what sources people are linking to the website and those kinds of things? So you sort of know the effectiveness of the strategy. Like, I know there's ways you can, things are posted on social media, you can track sort of what then goes to the website, etc.
Yes, so we have a couple different evaluation approaches. So one, we have a data analytics dashboard that tracks all of the paid media placements and the views and the impressions and the engagement as it's distributed throughout our designated market areas. So there's that more quantitative data being collected right now and will be collected all the way through June. And then we're also we of course did a lot of formative research on, you know, who are our target audiences, what should we create, what kind of messages will work. So there was that pre-evaluation that was done, but we also are implementing right now a tracking survey that will really use an online survey to capture what are folks' attitudes and beliefs and actions around Alzheimer's behaviors that are changing with the rollout of the campaign. So there was a baseline survey that was conducted in January, and there'll be a tracking study that is being collected ongoing, several waves throughout the spring, so that we can hopefully see perceptions changing, actions changing, and attitudes towards the disease. Hopefully that's what we're able to collect. So we'll have some really good, juicy evaluation reports closer to the spring on both the qualitative side and the quantitative side.
Perfect, thanks for that. Do other people have questions? Yes, Wynn.
Thank you for all this great work. You had mentioned that some of these brochures are going to be in the doctor's offices. I'm just asking for strategy on how you're getting it out there. Are you working with health systems to make sure that these things are indeed available? And I think that's the best place to have them. You know, the patients or people go to their doctor's office for any concerns, and if they see an ad like that, they could ask it at that visit or maybe schedule another visit. But just curious on your strategy. Thank you.
Yeah, oh, thank you. So they haven't been printed and made available just yet, but once they are, I know we're planning to reach out to our local health jurisdictions, our partnered local health systems, including our Alzheimer's disease centers and folks that we have relationships with, and then also new clinical partners that can get their hands on these resources. So we plan on printing quite a few. And like we said, there'll be larger posters on the wall, and then again, little take one, little grab and go brochure size. I'm not sure if brochure is the right word, but like grab and go, take one flyer type of materials, if you will. So we haven't rolled out the strategy just yet, but I know we'll be leaning on any existing partners we already have in the space and some larger healthcare partners as well.
We have an offer for helping.
Oh yeah, perfect. If you have any suggestions or anyone that we can add to kind of our distribution list, let us know.
When is your Kaiser dementia lead in the North Bay area? So she will
the whole region, actually.
The whole region, yeah.
Perfect.
The Kaiser working for the world.
Go ahead, Barbara.
This is Barbara. So Lisa, you probably already working with your partners over at DHCS, but you know, the CalAIM staff is talking to health plans every single day. And then, you know, so is the Dementia Care Aware program. So are you gonna see if they'll push these materials out to the health plans that they work with?
I would assume so. I know we keep in regular contact with DHCS. So I think once we have that distribution plan, we would kind of look at exactly how it makes the most sense for them to reach their networks. But if Lindley, if you wanted to add anything specifically on the DHCS side, please feel free.
Right. We don't have any specific CalAIM contacts, but we do work very intimately with Dementia Care Aware. They're already linked on our landing page. We already have strong connections, so they should be working with their providers in concert with us in our efforts to get the messages out with the healthcare providers that they're working with.
Dr. Mobley.
Yeah, I'm just thinking, Lisa, really great program. I'm just thinking that as these new therapies come online, and I wouldn't argue that they're online now. I mean, yes, there's two approved therapies. One has just been withdrawn. You may know that the antibody approach has been criticized for being not particularly effective and not particularly safe. But in the future, we will have effective therapies that will be safe, is a reasonable prediction. So I'm just wondering if there could in the future be a kind of, here's an update about what's happening in terms of therapeutic advances or even diagnostic advances in AD.
Yeah, I would hope so, as long as that's something that's in our wheelhouse to share information on as the public health department. We would definitely link to that in future iterations of the campaign. This is our first, of course, so we want to just build the awareness and the context in general, but we want to stay current of what's going on in the space and with treatments that are evolving. So I would love to include those messages in future campaigns, or even on our Alzheimer's disease program website as well, just making sure folks have access to that information if they're seeing it out there. So I really appreciate that question, and I hope we can continue to kind of insert that where we can, when we can.
Thank you.
I also want to note too that being the Department of Public Health, we want to be really clear on, you know, what we're trying to do in terms of our goals with Alzheimer's disease and building awareness, combating stigma, which is the purpose of this campaign. And I think our partnership with DHCS will be really important when it comes to diagnostic care, and specifically with innovations regarding medications. So we want to make sure that there's a very clear harmonization in the way we partner with state agencies when we do messages like that, hopefully in the future.
Other questions or comments from committee members? My last question / comment is just thinking about through local, I assume like a place you might go is local county departments of public health or so forth. And it seems like if you want to get the word out to a target audience, like have those county entities reach out to their senior centers for posting of information, those kinds of things, like just people in the community, I think sort of where might they go to generally get services and become a information. So that's just a suggestion from somebody.
Thank you. You know, exactly. And that's one of our ways of kind of disseminating the campaign. So we will be sharing the toolkits and the resources with every local health jurisdiction that, you know, we can. And I know you're all already aware of our Healthy Brain Initiative. I know there's been a few presentations on that here at the committee, but they're specifically going to be helping us with their funding to kind of take this campaign and, you know, adapt it locally and use some of their extra dollars towards getting the messages out there. And then for folks that aren't funded, there's a lot of those free resources and toolkits available that they can share on their own platforms and websites. So that's definitely the goal, is to partner with those local health jurisdictions, as well as, of course, our clinical partners, but getting that broad awareness access to resources through the local health jurisdiction, and the local health department is a big goal of ours. Oh, is Catherine speaking? Sorry, I can't hear her.
Oh, they muted the room. Somebody else muted us.
I don't know. I would just say
Please
thank
don't
you
mute the
for all
meeting
you're
room.
doing, and I think we look forward to getting some updates about how it's going and what the data shows and those kinds of things. So maybe keep us
Sure.
in mind for a future presentation.
Okay, will do. Thank you again.
Appreciate it. Okay,
I think
are we ready for our next presentation?
Yeah, Sarah and
You want to
Stephanie
come
are
up
here.
here? Wynn is gonna leave this, just so
I
you're
can be here. You can hear me, right?
Yeah.
Okay.
Yes, we can.
Great.
Great.
Well, let me introduce, well, I think we should start with why we have this forum here. According to prior studies, close to half of all Americans will have experienced a diagnosable behavioral health disorder by the age of 75. But what's important is that less than a third of these older adults in need of mental health services receive appropriate or much needed care. And this has been quite apparent during this pandemic when we observe social isolation and loneliness. And last year, roundtables in a few counties were held to hear perspective and experiences on older adult behavioral health from various stakeholders. I think I attended the one in Ukiah, and we talked about different things, including ideas to improve behavioral health for older adults, reduce stigma, and encourage open conversations around mental health, especially for older adults who are people of color and members of the LGBTQ community. And from those roundtables, we have shared this with our leaders, and now Sarah and Stephanie will share with us the outcome of those. The California Older Adult Behavioral Health Initiative. Thank you, Sarah and Stephanie.
Wonderful. Well, thank you, Dr. Canio, for that introduction. It's really great to be with you all today, along with my colleague, Stephanie Blake, who is the Department of Aging's Older Adult Behavioral Health Specialist. So we're going to, as Dr. Canio noted, we're going to talk with you about our initiative. And as Dr. Canio was also saying, this is a really emerging crisis that has for so long been sidelined in policy discussions, whether that's due to stigma, lack of awareness, or other competing priorities. But all the while, the issue of older adult behavioral health has never been more important to address than it is today. And as you noted, I was going to actually say the same fact point, noted by UCLA Center for Health Policy Research, that while close to half of Americans have experienced a diagnosable disorder by the age of 75, less than 1/3 actually received services. Something that also has emerged as a big driver in the epidemic of older adult behavioral health is isolation and loneliness. The National Academy of Sciences notes that about 1 in 4 older adults are considered socially isolated, and that could be due to many factors, whether living alone, the loss of family or friends, chronic illness, and other factors. We also know that immigrants, people of color, victims of elder abuse, and LGBTQ older adults are often the most vulnerable to isolation. So we really appreciate the advocacy of our MPA stakeholders who really called out this issue at our Day of Action in 2022, which led to a series of, older adult behavioral health called out in this iteration of the Master Plan for Aging. So as Dr. Canio noted, last fall, we convened 4 behavioral health listening sessions across the state, where we heard from older adults, caregivers, and providers on how California can better support older adults who are experiencing these challenges, particularly focusing on people of color and members of the LGBTQ community. So after these forums, CDA was really fortunate to partner with the Mental Health Services Act Oversight and Accountability Commission, where they launched a $20 million older adult behavioral health initiative, which replicated promising programs in certain parts of the state,
specifically where they're advancing the PEARLS model and AgeWise. But what we're here to talk to you about today is an initiative that the governor advanced in last year's budget for $50 million older adult behavioral health initiative to be led by the Department of Aging. So I'm really, really proud to introduce you to Stephanie, who's helping lead this initiative. She's going to give you an overview of it, as well as our progress and the next steps. So welcome, Stephanie, and thank you again.
Thank you so much, Sarah. And thank you everyone today for having me. As Sarah mentioned, my name is Stephanie Blake, and I'm the behavioral health specialist for the California Department of Aging. And today we'll be talking about the Older Adult Behavioral Health Initiative. Next slide, please. So the purpose of the Older Adult Behavioral Health Initiative is to address behavioral health needs of older adults, particularly those from underserved communities, with a focus on fighting stigma, providing support, and enhancing community capacity. Next slide, please. So this initiative is a $50 million general fund investment that will be utilized across 3 components. These 3 components include continuation of the Friendship Line, a launch of an ethnic media campaign, and awarding community capacity building grants. Next slide, please. So the first of the components is the Friendship Line. This is $4.5 million for the continued operation of the Older Adult Friendship Line, which is a statewide 24-hour, 7-day-a-week warm line for non-emergency emotional support calls for older adults, adults with disabilities, and their families and caregivers. This warm line will have the capacity to serve older adults in multiple languages. The effort will target isolated and at-risk older adults to ensure there is a place to call and a person to speak with who can provide emotional support. At this time, the contract has been awarded to the Institute on Aging, who previously operated the Friendship Line. Next slide, please. Next up, we have the Ethnic Media Campaign. This is $10.5 million to address mental health and substance use disorder stigma by raising awareness of available resources for older adults from communities of colors, immigrant communities, veterans, and people who identify as LGBTQ. The campaign will focus on raising awareness of the needs and resources available across the behavioral health continuum. This can include prevention and early intervention, outpatient care, crisis care, inpatient and/or supportive care. This effort will include data collection to identify the gaps in behavioral health access and service delivery to better target messaging to the public, and it was recently awarded to USIM. Next slide, please. And then lastly, we have the Community Capacity Building Grants. This is $30 million for grants to local partners for training, outreach, and capacity building to meet the behavioral health needs of underrepresented older adults in underserved communities. There are 3 key areas these grants will target for development or expansion. These are program development, workforce training and development, and community collaboration. The status right now is we expect for the RFA to be released in summer of 2024. And we will be engaging stakeholders and soliciting input on the RFA throughout the development process. Next slide, please. And lastly, we see this initiative not as 3 siloed components, but as 3 components that will work together to address behavioral health needs of older adults. For example, the Ethnic Media Campaign can direct consumers to the Friendship Line or to the potential programs that will be a part of the Community Capacity Building Grant. And I just wanted to say thank you again for your time. If you have any questions or recommendations beyond today, you can contact me directly, or you can contact our Older Adult Behavioral Health inbox.
Great, well, thank you so much, Stephanie and Sarah. Now we're opening the this forum to questions from our members, sorry. Any questions or comments in the room, Barbara?
This is Barbara McLennan. What does USIM stand for?
Wow, that's a really great question, Barbara. In fact, Stephanie and I were just messaging each other. It's the interesting thing is, and I will look it up online, USUM is the partner that also is working on the Alzheimer's Association the Alzheimer's public awareness campaign that you just learned about. So we're really excited to be working with them. And again, in terms of what USUM stands for, it is a vendor that we have contracted with for the communications campaign, and I will get you the information to provide you more information on their organization.
They did a lot of COVID work for us too. They did a lot of COVID work.
Okay. Yeah, it is just the name of their company.
Yeah.
Yes, correct.
USIM. It's actually USIM.
If you look at their website, it does not appear, I checked this out before the meeting, it does not appear to be an explanation of what the acronym stands for, so it is appears the actual name.
USIM is the name of
Is
the
the
company,
name of the
not an
company.
acronym.
It's not, it does not appear to be an acronym.
No, that's okay.
I'll put a link up to the website so you can learn more.
Another quick question. Out of pure curiosity, what kind of volume are you seeing on that friendship line? Good question.
Stephanie, do you have any of that data handy?
I do not currently have that data on me.
So
We
Barbara,
can follow up with the committee to get that information in terms of the data on usage and, any other statistics that we can pass along.
I mean, I'm just guessing it's really challenging to raise awareness that it exists.
Exactly.
Yeah, so.
sorry, it's very challenging
To raise awareness that it exists, so that people, so it might be a tool, but if no one knows about it.
Right. And that's exactly right. As Stephanie was talking about, we really see these three components of this initiative as interrelated. So for example, with the ethnic media campaign, really trying to make people aware of the resources such as the friendship line, the warm line. And similarly, in working with our community partners through the community capacity building grants, making sure that they too are drawing people's attention to that as a resource at the local level that they can call on and making it available in, providing more language access as well.
I think Sarah, it's kind of just like, I think this is what you said, like you'll get more information, but also just like if there's demographic information about who's calling, like what languages or any other information, I just think it would be interesting to better understand how is it being used, who's using it, which should help us understand for the future, like whether there need to be additional changes, right? So that'd be great.
Absolutely. Happy to follow up on that.
If you could share any materials to publicize it, and maybe locally we can look for places that we can put it so that we can get it out there too. So, if you've got social media posts about it or just really anything.
Yep, that's a great idea. And Michelle just did put the link up to more information on the friendship line on the Institute of Aging's website, but we will follow up with any other specific resources as well.
I'm happy to share that a couple of my patients in the last 12 years I've been in the North Bay have actually used this line and shared that with me. So I know that some people are using it. But yes, data would be good.
Yeah. We know too that the statistics, the calls are much longer than your typical calls, and there are repeat callers. So the volume may not be, we'll get you all of the statistics. We're so thrilled. This was enabled through one-time funding through the American Rescue Act. And because of the governor's and the legislature's support of this initiative, we were able to continue it. That contract would have ended. And so now I think we will be able to promote it more, because when it was winding down, we didn't want to call too much attention to it. And so now we're better positioned to really elevate it as more of a permanent resource.
Well, and looking at the data over time, I think will provide like some of that information, right? It's great you're doing the campaign and all of that too.
And just a question, it might not be germane at all, but is there a possibility for like TV ads or radio ads, or is it the kind of thing that it would be helpful?
We'll have to get back to you on that one. That might be included. I'm not sure. I know that Friendship Line grew out of the Bay Area and it's better known in Northern California. So our partners in the South could really help us to promote it. It's lesser known in Southern California. They have a
Unknown.
or unknown. Or unknown.
Being in Southern
Yeah,
California.
or Central Valley, for sure.
Yeah.
Dr. Mobley, it looked like you had a question or a comment.
Yeah, first of all, I really like the program a lot. Let me just agree about the really important issue that social isolation poses. It's one of the critical elements of the identified modifiable risk factors for dementia by the Lancet Commission. In fact, if you take depression and isolation together, it's about 1/5 of all the modifiable risk for AD. I'd like to know, would there be a way to do some work, do research on explicitly linking elderly adults with one another in a non-emergent setting? In other words, building local communities of older folks talking with older folks, just because it's a good thing for their mental health to do that. And I don't know what that would look like, Sarah or Stephanie, but building community, including family members, in regular connections might do a lot to help these folks stay oriented and stay healthy.
Yeah, that is such a wonderful point, Dr. Mobley. And I think we're all really, really eager to launch the community capacity building grants, because I think that's exactly the type of, kind of innovation that we want to hear about from our grantees in terms of what are some things that can be done on the community level. This is not a clinical series of grants. It really is addressing the issues in the community and trying to fight, loneliness and isolation as well. So I think that's a wonderful thought, and we will consider, how to frame this to capture promising program models at the local level.
Thanks very much.
Makes me think of the village movement.
Yes, I was
Sarah.
just gonna think.
Mhm.
Yes. No,
Great point.
So
Yep.
the village movement is about building community to help each other as we age. So that seems whatever you guys might be doing to build on this focus on older adult mental health, maybe connecting with the village movement would make sense, partnering with them.
Thank you so much for that suggestion. And I hope you all stay abreast of this as we, launch our kind of focused stakeholder outreach and engagement on it, because we welcome all of these suggestions.
Thank you, Sarah. Yes. Any other comments or questions? We're good.
So I think we're good.
All right.
Great presentation.
Thank you so much. Yeah.
Thank you all. Appreciate the opportunity.
Okay, now it's our time for the legislative update. Barbara, as usual, will
It's me and it's
and Eric.
And
Oh,
there's
hi,
Jason.
Jason.
Yeah.
Oh, I was
And if
gonna
you-
introduce Jason.
Eric on here, and I was like, you know, older version. And
Jason, right?
Jason's
Yes.
last-
Okay.
You
All right.
could come
Thank
sit
you.
over here. You want, okay, yeah, both of you, yeah.
Were you joining them too or no? No. I was just gonna offer to move.
All good. Next slide, please, Rosie.
All right, so just for the record, introduce myself again, Barbara McClendon, public director with Alzheimer's Los Angeles, but I also want to note that we do our public policy work in partnership with Alzheimer's Orange County and Alzheimer's San Diego as well. So what I'm talking about, all three of our organizations are supporting. So next slide. Susan already shared this information, so I don't really need to revisit it, except to say how thrilled we were that there were no cuts to aging programs. Those of us who've been working in this space for a while know that that's not always been the case. So I think that that is reflective of the commitment of this administration to older adult programming. So we were very happy to see it. Next slide. So our three organizations, these are our guiding principles when we are determining what our own legislative priorities are going to be, and then what our positions are going to be on other legislation that's filed throughout the session. You know, we're really expanding access to services in the community, which is where most people want to live. It's a point of education often that all people with a cognitive impairment are not living in a nursing home. A lot of people think that, but it frankly is the case that many people can stay in the community if they have appropriate support, even if they're living with a cognitive impairment. Supporting family caregivers, I mean, there's just so much work to be done in that space. Building a dementia-capable healthcare system and workforce, a lot of progress has been made. I think as the state is unfolding or building the CalAIM program, they really are doing it with a dementia-focused lens. And so, you know, and partnering with those of us in this space really, really well. So we're definitely making progress in that area. And then as we were saying earlier, addressing the cost of care, that long-term services and supports benefit, among other initiatives to try and take a look at that, is really going to be critical as we move forward. Next slide. So next is legislation that, thank you, that is out there right now. And I know, Jason, you're going to speak about what the Alzheimer's Association's priorities are going to be on. I won't be covering that. We are very early in the legislative session, so the bill filing deadline is not until, I think it's February 16th. And legislative staff are just like students, cramming in at the last minute. So we get this little trickle of bills through the month of January, and then in early February, it starts to pick up, and then the last week or 10 days, it's just a flood. So when we come back in May, Susan and I are going to be talking about a whole lot more than what you see here today. So I will just focus on, again, my organization and our partners. We don't have a bill number yet. We hoped we were going to have one by today. Maybe it'll come tomorrow. But the last couple of years, we have been working to try to address this issue of wandering. So we've had a bill that was the last couple times that proposed a task force, and we have situated it in past iterations within the State Department of Justice. There were challenges around that. With costs that got attached to the bill. And then this time around, as we were sort of looking like what state agency might we place this sort of an initiative in, and through some conversations with state agency staff, we actually were guided towards considering the Commission on Peace Officer Standards and Training, otherwise known as POST. And so what they do is they develop guidelines and trainings for law enforcement. And so this latest version of the bill, which was designed hopefully to attract minimal costs so that even in a budget deficit world, we still might be able to get it passed. And so it directs POST to craft these guidelines, and it provides some specific guidance on the expertise that we want them to seek out as they're building these guidelines. We want to talking with people in the Alzheimer's and dementia space, as well as from the autism community, so that that can be informative of the guidelines that are developed. And we've tried to sort of stretch it out as much as we can so that we're really thinking about law enforcement in a broad sense of how they're interacting with their larger, wider community. But I do want to make the point, because this issue came up in our conversation earlier, that because we're picking this route with this piece of legislation focused on law enforcement, which is a key component for addressing wandering, there are very important other aspects to the issue that probably reside a little more comfortably in the Health and Human Services space. So that's another reason why I think in our letter to the Secretary, raising up the issue of wandering and making the case for it being a priority for Health and Human Services going forward would not be duplicative of what would be accomplished through this legislation. It would be complementary. And I think that's my last slide.
Do I have one more? Is it just a goodbye slide? Oh, this is more detail about the bill. So that's okay. I talked about some of this already, so we can actually. But it just shows how we tried to like think of everybody to include, and that's just our.
So but have you included any costs for them to develop the guidelines?
So there'll be some costs associated with it. Yeah. What we're trying to do, just to be perfectly honest about it all, is typically the appropriations committee will set a dollar amount and anything over it gets held. We're hoping to come in under it. And we don't know exactly what that cap is going to be this time around.
5,000.
Yeah, I don't think it'll be 5,000. It's typically a little more than that, but it's not a lot.
Not a typical year.
And it isn't a typical year. So we will see, but that is our goal, is to try to, because this is what Post does. We aren't asking them to do anything strange or to, they develop guidelines. We're saying, here's a topic for you. And we also know that the Department of Justice is sort of in their natural cycle of things, updating their guidelines as it relates to missing and unidentified persons, broadly speaking. So it's to be very complementary with that effort, building on what is already there, again, for that larger issue of missing and unidentified individuals with this specific focus on those with special needs, particularly people living with autism or another cognitive impairment.
Rosie, could you pull up the next set of slides, please? And while she's doing that, Jason, do you want to introduce yourself?
Sure, I'm Jason Gabhart. I just started with the Alzheimer's Association on January 2nd. So tomorrow will be my 1 month anniversary. So bear with me as I give you these updates. I'm still a newbie, but as Barbara said, there aren't many bills introduced yet that are really important to our cause yet, but in mid-February there will be. So at the next meeting, we'll have an onslaught of bills that we can talk about. So I was just going to go over 2 bills that we know that as the Alzheimer's Association, we're going to move. So if you can go to the next slide. Actually, no, it's the wrong one. I think that was the first. Okay, yes. Okay, I'll speak about this one and then there's another one. This is SB 639, diagnostic hubs. It is actually a 2-year bill. It moved its way through the legislature last year all the way to concurrence in the Senate. So it went through the first house and made it back to the second house. Wasn't getting any no votes. And then at the end, we had to put some amendments in from some of the departments. And so there was a big price tag put on it. So we decided not to move it last year. And we're going to work on it again this year. Just for background, the CADCs, the California Alzheimer's Disease Centers, the network of sites, the University Medical Schools, overseen by the Department of Public Health. They provide specialized training for healthcare professionals. And also there's Dementia Care Aware that I think everyone knows about, but overseen by the Department of Healthcare Services. Dementia Care Aware is supposed to sunset at the end of this year. So we're looking to get funding and coordination needed for both of these programs. And what we wanted to create was I believe the hub and spoke model that was suggested in the governor's master plan for aging. And so, okay, next slide, please. Specifically, the bill right now, there's a few requirements. It's going to rename the treatment centers to diagnostic hubs. Training of healthcare professionals through the diagnostic hubs. They're going to be increased by expanding educational relationships, support primary care. The hubs will now have to create capacity to secure access to new Alzheimer's clinical therapies coming to the market. And then they also have to collaborate with DHCS to promote Dementia Care Aware in its effort to continue to expand upon its cognitive health assessment training. So what we're looking to do is bring Dementia Care Aware under the CADCs and then let them continue to do their diagnostic services and and do the outreach to physicians to get training that they need. Our other bill, which wasn't on a slide, it was AB 387 from last year, a bill introduced by Aguirre Curry, Assemblymember Aguirre Curry, and that was related to the Alzheimer's Disease and Related Disorders Advisory Committee. That got stopped in appropriations because the costs were too high. The committee currently is 14 members. We wanted to expand it to 21 members, but that increased the price tag. So this year, we're looking to just add 2 new members that would be selected by the the Secretary of Human Services, they would put 2 new people on the committee at their discretion. So we didn't want to go all the way to 21 committee members. And then it also revises the phrase Alzheimer's disease to change that to Alzheimer's condition or related disorders, as it is in statute. And then also removes a 1-year term limit for the 2 committee members that are on there that are living with Alzheimer's or related dementias. They were the only committee members that actually had a term limit on there. We wanted to remove those term limits. So we will be pursuing that bill again this year. We are working with Lisa Coleman from the California Commission on Aging because they have a similar bill that they want someone from her group to be also on the committee. So we've agreed that we'll move forward, and if anything in our bill or their bill stops our bills from moving, that we'll work together to make sure that our bills move forward. So those are the 2 issues that we know for sure that we're going to be working on, but as the time goes on, there'll probably be more bills that we get on to support and or oppose.
And I'm sorry, Jason sent me an updated.
That's all right.
In all of the updating of slide decks, apparently that one did
Yeah,
not get in, so I
No worries,
apologize.
yeah.
And so we have time for questions.
I just want to underscore the importance of the work that you're all doing in terms of bringing information to lower socioeconomic communities and people of color who are less likely to have the information they need to be able to help family and friends and to be able to get them to doctors to be diagnosed. It's just such valuable work, and I really want to thank you.
For the Angela Code bill,
Uh-huh.
thank you for continuing that. It's been really important to this committee. So for the 2 new positions, do they identify any characteristics or they're just at the discretion of the secretary?
At the discretion. At this time, that the bill, like I said, we don't have a number yet. Language has been introduced, but that could always be amended if there is something that you want to
Yeah,
get specific backgrounds or specific.
I mean, I think our interest in part was eliminating the stigmatizing language
Right.
and addressing the term limit,
Right.
which frankly seemed discriminatory to
Yeah,
me.
definitely.
And we had, I personally had suggested that if, you could give the authority to the secretary to add additional positions without requiring it as a way of
Authority, right,
saying that,
yes.
like, it's this number of people,
Mhm.
like, you're encouraged to add 2 other positions, but you don't have to, because then it doesn't really
Yeah.
have a cost
Cost,
implication, right? So that's just my 2 cents about maybe how to deal with the budget.
Right.
Any questions or comments from their Zoom folks? No. Okay.
You look forward to more.
I
the
know.
next
So
meeting.
do we. Next time.
We appreciate your. kindness.
So for someone that wondering, keep coming. No, we're not big puppies.
Okay, we can do that. So we have had such a good and efficient meeting that we're gonna just reconfigure the agenda a little bit. We need to leave public comment at 1:35 because that's when it's been noticed. So if people weren't here or wanted to say something, they could, and we certainly want to hear from the public. So we're gonna take a little time to identify the suggested items that would go into the letter to the secretary, and also topics for subsequent meetings. So I think we've heard some ideas throughout today, but let's just say them again in kind of a short form, because I think Michelle's been taking notes as we've been going along with some of the details. So,
And maybe if we could do it like one at a time, like do the suggested topics for future meetings, yeah, that'll make my life easy.
so let's start with the suggested topics for the meeting, and then we'll go to recommendations for the secretary. I think we asked for potentially did a presentation from the, I think it must be the California Emergency Management Services Group about what are they doing on some of the items of of interest
Yeah, I
about emergencies and wandering and so forth, so we can.
Explain to us what they are doing to help sort of set a floor across emergency response for training and understanding the needs of people living with a cognitive impairment. Just helping us understand how authority is delegated. So if you're gonna advocate for systems change, you gotta understand the system. And I have to say, their system is opaque.
And I'd just like to add, just piggyback a little bit on that. With everything that you said, but also the training on kindness for those people who are perhaps wandering or are lost or whatever, or who are belligerent, you know, and just dealing with those issues as they come along.
And I think another topic for presentation, Todd had provided information about what was the current system in San Diego about wandering and the training that went with it and the response to it. So I think if we're trying in this space to sort of understand systems and what might be working, we could, you know, work with Todd to identify who are the people in San Diego County. I think Barbara also identified as sort of a model that we could have come to a kind of follow-up presentation to the discussion that we had.
Across the state.
Yeah. So I am also, this is Barbara, I'm also talking with Riverside County because they may have something. At least they have a website and a program that calls itself the Special Needs Reunification Program. And we just don't know enough. Like, I'm much more familiar with the Taking Home program in San Diego. So we just don't know enough yet about that program to see if maybe that's another model. So whatever I learned, Michelle, I can share with you. And
Share with Michelle, and as we're sort of thinking about what month are we going to do this kind of follow-up conversation, we could add whatever great information you do. Do other members have ideas that they would like to have discussed at a future meeting?
I do have another one.
If anybody else wants to say?
Yeah, I can add something
I
to
bet
it.
people have good ideas.
Yeah. Just adding to, you know, the emergency preparedness that we talked about today, but the role of adult protective services and ombudsman in dementia space, I think is something that we can all learn from. I know some of what they do in where I live in Marin, Sonoma, but would love to learn from others and opportunities that we can identify to improve, you know, their relationship with the people living with dementia and working with the caregivers, trying to provide care for them. And that is sometimes something that is missing.
And I think maybe just expanding it a little bit to also talk about like abuse prevention, right? What's happening there and what materials are available for caregivers and individuals that live with dementia so that they have some strategies about what they can do about that. So that'd be great. Other people on Zoom, and then we'll go back to Barbara, who always has ideas. Okay, Barbara, while they're thinking, your idea.
So I would love us to take a look at, this is another issue that came out of our caregiver support groups. And it relates to caregiver access to loved ones who go into hospital settings. So there is, within CDPH, it's got a very long name. I can email this to you, Michelle, if you want. So it's the Center for Healthcare Quality's Licensing and Certification Program. I would love to see if we could get them to come to a future meeting and just help us understand what role they might be able to play in taking a look at this issue. What I had in mind.
I'm sorry, I must have missed what issue.
So my understanding is hospitals are sort of, you know, they're their own little fiefdoms and they can set their own rules about visitation. And we have had caregivers who, because of the rules of some hospitals are great and they have let that caregiver stay with that loved one with dementia and, you know, support their care and others are terrible. and don't let them, the loved one with dementia goes into the hospital and it's very limited access to them, and it impairs the quality of the care they receive. And so we wanted to explore, is there a floor we could set? Is there something we could do so that it wasn't so, like, if you're lucky enough to live in a community where with a hospital that's progressive on this issue, lucky you, and if you're not, well, too bad, right? And I know that CDA has a work group right now that grew out of COVID about access to in care facilities. And so my thought wasn't, like, I'm not coming with an answer. This is a very complicated space, the healthcare space. But I would love to at least begin looking at the issue and educating ourselves about what are all the components of this. And so just with an ultimate goal of how can we better support our caregivers to support their loved ones when they go into a hospital setting.
So I think that what I'll add to that is there's actually, so, my background as I'll just say a disability civil rights lawyer is really about what does the ADA require in terms of accommodations. And there's been a fair amount of work done in that space, including, for example, can someone bring a support animal into the hospital with them? And the answer is actually yes, under the ADA, if you can establish a criteria, even though animals generally are not allowed in hospital settings. And there's been other cases about, can you bring in a support person if that's necessary for you to be in the hospital successfully and those kinds of things. So I think adding kind of that ADA perspective would be like another interesting part. And I'm pretty sure my said Disability Rights California.
And I had not even thought about that.
Join us.
That's such a.
So it's just like, I think that the topic of sort of how do you ensure people have the kinds of supports they need when they're being hospitalized for maybe even a condition unrelated to their dementia, right?
Almost
physical health care.
Almost likely to be.
And how do you, yeah, that'd be great. Okay, other ideas?
I just wanted to see, did we sufficiently address the wandering conversation? I'm just not quite sure, like in terms of people who are just
so
far gone
I
that.
think we've addressed it in two ways. One, an education piece for us about sort of what's happening, right? With what's happening in San Diego, maybe Riverside, and that would help inform us. And I think it will also come up again. We sort of bifurcated them. What do we want to tell the secretary who we give advice to about that? And so that'll come up, I think, very shortly in our next discussion.
Oh, terrific. Thank you.
Anybody else? Okay, I think no, hold on. Sorry, Todd, thank you. Sorry, I'm like, Dr. Mobley used to be in the top left corner, but he's no longer there. So Todd, feel free to identify.
Just real quick, along these same lines, I know that, I sound like a broken record, but Barbara and I have talked about this a couple of times on different committee meetings, that wandering is a huge issue. It's one of those unrecognized risks that people don't understand. There's no prediction of wandering. There's no way to predict it's going to happen. And you all know the grant path a lot better than I do at the state level, but I think this is something that is really ripe for a public service campaign that would include PSAs and billboards and things like that. There was a very, very effective campaign that was done 10 or 12 years ago regarding elder abuse. And basically the tagline was, elder abuse is getting old. And it had some very, specific images, eye-catching images, and it really hit the point home, and I think moved the needle in awareness and education about elder abuse. We need the same kind of approach, and we need the same kind of awareness about wandering. And I think taking it to the public and educating the public would make them much better stewards of that out in the general community and population, but it would also make people aware in basic settings of going to the grocery store, going to the mall, going to the doctor's office, and assuming that somebody's not going to get up and wander away. It can happen in a blink of an eye, and we all hear and see and read of those tragic stories that happen in every county in California. So I would just put that out there, that we should keep raising that banner and blowing that horn about wandering awareness. And I think there are ways to effectively communicate how much of a risk it is for everyone.
That's great. So I think that's a nice segue into issues that we want to raise with the secretary. So wandering is on that. We had the prior discussion about doing some additional education of the committee about what are current strategies being used. San Diego Riverside came up to kind of the forefront. So also out of that discussion, there might be further opportunities to identify even some more specific strategies about what we might do. So thanks for that. But we have our first thing we want to add is something to the secretary. So other folks have, okay, it looks like Dr. Mobley, you have your hand up.
Yeah, just wonder if there's also value in a future meeting and really discussing the modifiable risk for dementia in the elderly. I think it's not perhaps well known that hearing loss can be a major contributor to dementia risk. And perhaps discussing it here would be useful because I would hope that ultimately Dementia Care Aware, for example, would have every primary care physician ready to speak with families about these risk factors that could be really discussed at a meeting where, yes, the diagnosis has been made. We want you to know that there are still things you can do to enhance your life and to avoid really problems. And so I think just having the committee be more aware of the science behind this and be able to promote that to the secretary as really being an important message to primary care providers would be perhaps useful.
Thanks for that. Good suggestion. I'm always struck by how people are quite comfortable getting glasses, around the time they turn 40. And when you start talking to people about hearing loss, like, no, thank you, I don't want to do that, right? And so it's an interesting why they both impact how you take in information, right? That there's more of a reluctance with hearing loss. I find that interesting. So good topic for us to think about. And more generally the hearing loss, but risk factors, including loss. So thanks for that. Anybody else have topics? Sally raised her hand.
I just wanted to chime in as someone who has worn hearing aids probably close to 20 years and also work with many older adults with hearing issues. And I am probably the biggest advocate for when I see my clients with issues, I say, get hearing aids now. Earlier is better than later, because what people do not realize is you wait too long, your brain has to learn how to hear all over again. So whenever you see a family member, anybody, encourage them, go sooner rather than later, and you can go to Costco and get some pretty affordable hearing aids.
Well, the technology has changed so much, how they connect now to your cell phone and you can adjust. I mean, it's pretty amazing. So thanks for the additional. Seems like we have yet another topic. We will not be short of topics for the next year. That's what usually happens in this group. Okay, let's turn to the letter to the secretary. I think we can probably finish that before we open it up for public comment. So there will be already a note, as we said before, about wandering and saying that. I think there was some interest in specifically calling out emergency preparedness and the importance of having specific materials and approaches for people with Alzheimer's and other dementias, which are the purview of our committee. And I think Michelle's earlier notes can sort of identify that, or Barbara's probably already given her a note of the specific words we should be saying. So I think that's a really good follow-up from that rich discussion this morning. I think I would also just continue to call out the importance of amending our statutes so that we don't have discriminatory language and artificial term limits on people living with Alzheimer's as members of our committee. So we could add that. And do other people have ideas of what they would like to tell Secretary Callie. Our opportunity to help inform HHS policy, which is always a great opportunity. I think the other topic, just while people are thinking, that came up for me was the public awareness campaign and kind of the initial work kind of ending in June related to funding and the importance. I guess I would frame it as looking at the data that was collected during this project and using that data to inform subsequent steps in the public awareness campaign, including the possibility of additional sort of public service announcements that are the cost component of it, so that we don't have this very, February to June is not very many months, it's like 5 or something, and that isn't really a long period of time to get a good ramp up of awareness and how we might continue that work.
I wonder if we could broaden it to that we don't want these excellent dementia resources that have been developed to wither on the vine. And so that public awareness campaign is one example. So is Dementia Care Aware, whose funding is gone.
That's a great idea.
at the end of this year. So that would just be such a shame. All of these materials and supports that the work that's been done to try to pull in primary care providers to use these materials to diagnose people. We want the secretary to figure out a way that program could continue.
Yeah, great idea.
We've been talking about awareness in the public forum, primary care, but we all know in healthcare that we all take care of people with dementia. But not everybody is aware of or sensitive to their needs, whether it's talking to them, having a disease appropriate language when speaking to them, or how to engage caregivers. So we're doing all of these awareness. Yes, we're going to diagnose. Yes, we're going to manage, treat them. But then what about the rest of the health workforce to be able to, take care of these folks effectively in the ER or the hospital, wherever they are in the health system? I think it's important to educate, not it, in a way, it's sort of like, I guess, dementia care awareness 2.0, rather than just being in the primary care setting of being able to detect this early, but spreading it throughout.
And I think, as I recollect from 2 years ago, a master plan update or reboot, that was one of the priorities for this committee. So I think we could take the language from that and make that one of our recommendations. So that was a good reminder of, we should continue to talk about the need for education and every person providing services to someone with Alzheimer's or dementia, so that there's, an appropriate skill set for caregivers.
And if I could just piggyback on what you were just saying. As I mentioned before, it took me many, many years to get a diagnosis. My GP kept telling me, "You're fine. Why are you still harping about this?" So I think that that's something that is really, really important, that physicians need to be trained. I think it's a special training to be able to identify people who might be suffering from Alzheimer's. That was one. And the other was, at one point in time, there was a time when we were taking a look at peace officers and a similar situation. Do peace officers, and are they sufficiently savvy to know, to recognize Alzheimer's as opposed to someone who is drunk or on drugs, or, that kind of thing. Those are just my 2 notes.
Thank you. Thanks for expanding the sort of knowledge and where the knowledge needs to be embedded. So that's great. Other people on Zoom, do you have other ideas of things that should be included in the letter to the secretary? don't think we have any other hands. I think we have a pretty good list of topics for one letter. We like to keep them not too many pages, hoping that the information will then be used and useful to him as he's thinking about things. So that seems fabulous. Michelle, do you have a thought? Because I think the only thing left is really public comment, right?
Yeah, and let me just check because it looks like there might be some things. So maybe what we can do is, Rosie, if you could pull up the slides, we'll go through the slides about the upcoming meetings and some other things that are happening, and then we'll come back to public comment slides. There we go. So this is our meeting schedule for the rest of the calendar year. And you have received, committee members have received invitations for all of these meetings, and the dates are posted on our website. But so our next meeting is May 9th. That is a second Thursday, so it's not to conflict with another conference that's going on. August 1st, November 7th, and then October 8th is the California for All Ages and Abilities Master Plan for Aging event. Our committee meetings will continue to be held in person in Sacramento with a Zoom option. So I will always be sitting in this room, and I'm happy for others to come and join me. And I appreciate all of you who are with us on the Zoom as well. Next slide, please. There we go. Do you want to talk about the California agencies today? Do you want me to?
Why don't you feel free to talk about it? That'd be great.
Sure. So the event in October is going to be held at the Sacramento Convention Center. Our team is still finalizing the exact time, but it's most of the day kind of meeting. And this is the meeting that Susan referenced earlier that we have every 2 years. We bring together our partners from all of our different committees that are involved in giving guidance around the NPA. So that includes this committee as well as several others. And so prior to that, so part of the time in our May and our August meetings, there'll be a process for you all to provide your recommendations on initiatives and activities for the next 2 years of the NPA. So our team is still working on how that process is going to work this year, but so every 2 years we kind of update. It's like, okay, and some things carry on. So some things that started in the first round of NPA initiatives made it into the next round and probably will make it into the third round. I think about things like long-term services and supports funding. Haven't quite finished that one yet. Some things, the work ends as part of an initiative, but maybe continuing within a department. And sometimes new things come up that we hadn't got to work on yet. But the group feels like it's, time to kind of take that up as an initiative. And so this meeting will really be to kind of gather all of those so each of the committees and other staff from different departments will be making their recommendations on what those priorities should be for the next 2 years. So for 2025 and 2026 of NPA work. And then we'll also, it's just an opportunity for us to all kind of renew our commitment to the work and the value we see in it, and to keep accelerating progress on this. As Susan talked about that, California 2030, when a quarter of our folks in California will be 60 years or older. So making sure we're accelerating the progress on this to catch up with our demographics, and then engaging, bringing our leaders. We bring state leaders. There are also some national leaders sometimes that attend as well, foundation leaders, to really look at this approach. And we talk about the whole of government approach, right? So this is not any one department or agency's issue to work on. Aging is something that goes across the work of different departments and agencies. We've probably talked about at least 5 different agencies today that could have a role or should have a role or do have a role. So really kind of looking at how do we continue to chart this path forward, and really to help California be a leader in helping other states see how you can do these things to make sure that we can all live happy, healthy, and long lives, and engage in our communities and receive the services and supports that can help us do that. So there'll be more to come on that event, but just keep it on your calendars and we'll.
We may not have gotten a calendar slip for that one because I didn't have it.
Okay.
I just
Okay,
signed it online,
okay.
so.
So yeah, so Carol, just make sure that this committee gets invited for the October 8th. They may not have done the full calendar invites to all the committees for that one.
Now we know.
But
So-
yes, but it's on, should be on your calendars and Carol will be updating invitations shortly, probably once they have a time. And they'll send it out. All righty, next slide, please. Righty. And as Susan mentioned, CDA is 50 years old this year. Woohoo! And so one of the things that we're doing is our communications folks are collecting and sharing stories. So we have a 50 Stories, 50 Years campaign that we've launched. Maybe Carol or someone could drop the link to that in the chat for me since I'm speaking. And so this is really to share stories from people whose lives have been positively impacted by California's network of aging services. And so it gives us all a chance to kind of talk about the role that people have played in shaping these programs and services over the past 5 decades as we think to the next 5. And so as committee members, we invite you all to share your stories too. So if you have thoughts about, oh, go back one, sorry. If you have thoughts about how experiences or insights that you think would be good examples to share about the work that's been going on in California around aging over the last 50 years, the email link is at the bottom of the slide. It's dropped in the chat. I'll send it in the email after the meeting with the follow-up materials, but you're welcome to reach out to our communications folks and share kind of your story, and who knows, you might end up popping up on our website with our 50 stories. So I'm guessing they'll probably end up with more than 50 stories. But so yeah. So now I think we can probably, Rosie, if you can back it up to public comment, please.
And while we're doing that, I'll just note there's a comment in the Q&A from Alexandra Morris, which says geriatric care management, and that she was a professional trainer with the Alzheimer's Association of Northern California for 21 years. And 10,000 first responders and other professionals in regards to interacting with people living with dementia. I welcome a conversation regarding wandering and kindness and interacting with folks living with dementia. Yeah, she's provided some contact information. So thanks for that.
Thank you. I know her well. She's a fabulous trainer.
Yeah, so that's great. But maybe somebody we can also list in presentations. All right, are there other comments from the public? Is there anyone in the queue that wants to speak?
Yeah, so just to remind you, if you are would like to be a part of public comment, please use your raised hand function on your Zoom webinar toolbar. And if you are on the phone, you can press *9. And I see that Debbie Toth has her hand up, so you can unmute yourself, Debbie, and give your comment to the committee, please.
Hi, everybody. My name is Debbie Toth. I am with Choice in Aging, and I have about 50 minutes of comments. I'm going to try and do in 2 minutes or less, understanding that there's an interpreter who's going to have to translate my speed. So I will do the best I can to be brief. I want to comment first on the emergency preparedness presentation. I think it was fabulous, and I really do believe, despite not hearing specific examples to Alzheimer's and dementia, everything we heard is translatable to us, guiding us through how we think through what it means to provide appropriate, accessible places and spaces for people with Alzheimer's and dementia. I think I can share with you that I had the experience of going to an evacuation site when there was a fire near my home, when I heard that board and cares were being evacuated. And I learned 3 things. One, there are different kinds of shelters that the Red Cross puts up. This particular one, nobody was allowed to lie down. So there were people with Alzheimer's and dementia who were in their 80s and 90s who were scared and lost and only could sit or stand. That's a problem. There was nobody there when I asked if they had an Alzheimer's or dementia specialist. They looked at me like I was nuts. I was that person, and there was a woman who was in her 90s who had literally no short-term memory. And every 30 seconds, I told her for 4 hours that there was a fire and we were evacuated. That particular boarding care home, their plan, their partnered agencies, I know one of the members of this committee talked about these great plans that centers have. They didn't have one, and they didn't have a reciprocity agreement. And I ended up bringing this team of older adults who didn't have any staff who spoke English to a hotel in the next county so they could lay down. This is what emergency disaster preparedness looks like for people with Alzheimer's and dementia. Don't know if anybody from the Office of Emergency Services is still there, but they need to hear this. They also need to understand that they are stripping money away for elder abuse, which predominantly impacts people with dementia and Alzheimer's in the early stages. And that's an emergency to me of a different sort, perhaps. I also want to hope that you add continuing the CalCompass project on the secretary's memo, like was mentioned in training of the medical workforce. The state plan for Alzheimer's in California has the Alzheimer's daycare resource centers in it, and we must continue to elevate this work. I want to point out that, as referenced around training the medical workforce to care for and recognize and diagnose Alzheimer's, that we have an issue that geriatric medicine is an elective in medical school, so it's no wonder that physicians don't know much about Alzheimer's or dementia, even though the #1 risk factor is age, and 25% of our population can be older adults by 2030. So there's a lot of work that we have to do there. And I just want to say that Choice and Aging turned 75 this year. California Department of Aging, we're older and wiser, and we would love for you to come and see all the things we're doing. We're actually working with somebody at CDA to share some of those stories. So thank you for the opportunity.
Thank you, Debbie. As always, a wealth of information in your comment. So thank you very much. This is our public comments section of the agenda. If you would like to provide a public comment to the committee, please raise your hand. We're happy to hear from you.
Carol, while we're waiting for other public comments, we also have one of our former members here, Andrea Robert, who we want to just acknowledge. So you let me know when the right time to do that is.
I've added her spotlight so we can be ready to talk with her. Give it a couple more beats for the public comment period.
People with comment in the room?
Any comments in the room?
No comments in the room.
Okay. Catherine, what's your, I think we can move on.
All right, perfect. Thank you. I'm really thrilled that Andrea has joined us for the end of our meeting today. She was a member of this committee for several years and just provided fabulous input, helped us be clear about the things that were most important to individuals living with Alzheimer's and other dementias and brain injuries, and helped us often think about the impact on underserved communities who lack information and lack services. So we wanted to just take a moment to acknowledge her many contributions to our committee, to thank her for her terrific work. And anyone else that wants to say anything, I'm happy to give you time to say that as well. And then we'll give Andrea a moment to say anything any final words of wisdom she wants to share with us.
Yes, well, and she also brought a lot on workforce issues and workforce related to caregivers, and had very helpful stories and information, and then was a strong ambassador for this committee. Our two new committee members both came directly from her recruitment of them. So even as her term was ending, she made sure that we have two new great folks joining us on this committee. So It's been a pleasure, and I miss you already, but I'm so glad you're here today so we can acknowledge you.
Lots of applause in this room for you.
Am I up?
Oh, yeah.
Oh my God. First of all, I want to say hi to Ken. You made it in. I'm so happy.
And Myra also.
Oh, Myra. You guys got the best of the world. They're great, great, great. So it is so good to see you guys. So I want to thank everyone for allowing me to sit on this committee. You know, sometimes everyone don't have a chance to sit at these tables, and not only that, have a voice. So I want to thank you so much, especially Catherine and Michelle and Jared. So thank you guys so much again for allowing me to be part of this committee. And then also, I just want to thank you because I had a chance to see what the state of California do in the background, sometimes just as a consumer or a constituent, you don't know. And so I've always known that California was the forerunner for a lot of programs. So it was really nice to see that this is the work that you all are doing. And I always pass this information on to others. So when I hear someone say they don't like the governor or California's not doing anything, I stop them in their tracks and I let them know that California is out there pushing recommendations and initiatives. So I'm just so grateful that I had a chance to be on this side of the table. Also, you know, keep in mind, somebody said that I was really instrumental in the workforce. That is so important to make sure that the people that's doing the work continue to do the work. You don't want to have a situation where you need services, your loved one, your children, yourself, you have some type of illness or condition, and someone shows up at your home to give care. And when they show up, they are exhausted because they are working multiple jobs. And you want to make sure those people are also paid correctly. It is easy for us to forget that because no one wants to go into the hospital. No one wants to transition and have to have the care that we need. But you want to remember that while you're doing these initiatives and these recommendations, that one day someone, even you, may need these services, and you want the person that show up, you want to make sure that they're happy. So just, you know, I'm just asking people to keep that in mind. And then lastly, for the workforce people, please keep that recommendation out there in regards to making sure that folks are properly trained, they have access to training, and then also there's some type of bridge in regards to academic academic moving up. You know, if a person is a caregiver, they can move to a CNA, to LVN, to RN, or maybe something totally different. Because anyone that wakes up in the morning, no one wants to wake up in the morning and know they have to go somewhere and struggle, working multiple jobs, not being able to be home with their children and their loved ones. So please keep that in mind. That is so important that we really push that effort. And, I heard that you guys are out there, you're partner with Chaffey College, which is one of the colleges. And so just keep doing the work that you're doing. One last request for you folks that are decision makers, and you have the decision or the obligation to hire minorities, please do that. If you look at the squares on this Zoom, there's not a lot of people, diverse people, and they're qualified, they're out there. And I just ask you, if you had those opportunity to be in the process of hiring, please look at people that can make an impact in communities of color and people like ourselves that's dealing with some type of impairment. But again, thank you guys so much for being there for me. You have any recommendations on any committee? I'm on board, and just thank you guys.
Thank you so much. For all your wisdom today and that you always share. Thank you.
Thank you.
Great to see you. Take care. Okay, I think we have ended our meeting even a few minutes early. That's pretty remarkable, given the amount of information we covered today. Thank you, everyone, for participating by Zoom or in person. It was great to see everyone in the new year, and I look forward to seeing you in May. It'll be our May 9th, our next meeting. So take care, everyone.
Bye. Good seeing you, Ken. Bye.
One point I was hoping you had.